Before we get started, just kind of recap what we've been talking about, and I know the department has been reaching out to several of the committee members. Hopefully everybody is. At the last meeting, we basically talked about maybe some structural changes, maybe some goals within the department, short-term and long-term goals. And what this committee is going to do is we'll try and meet every 6 weeks to talk about how we're accomplishing those goals, how we're moving things forward, how we're logistically moving forward. So the department has provided for you a binder of structural recommendations with timelines and also articles involved in there. So just to let you know, this binder will be added to as we have committee hearings. So if you want to keep your binder here, the Senate staff will be happy to add to it. If you want to take it home and make sure you have it as a reference point, it's there for you. So members, what we'll do is, once again, this is a working meeting. We're not working on any kind of legislation, so we're all probably on the same page as far as wanting to move this thing forward. So what we'll do, y'all, is we'll hear from the department. We'll hear from not only their recommendations, but their timelines and logistically what they're working on. And when they do work on it, how it's moving the needle for the safety and health of the children and the people in Louisiana that we care so much about. But once again, let's make it a free-flowing conversation. So if, as we're talking about anything, you see something that brings up that you want to visit, I'll be the moderator, and we'll just keep this thing going. So if it's okay with everybody, we'll start off with the department first. They'll talk about where we've been from the last meeting to now, what we've accomplished, what we've maybe not been able to accomplish, and then we'll just open it up to everybody, and we'll go from there. Is that okay with everybody? Well, Madam Secretary, you and your team are ready to go.
Thank you so much, Marquita Garner-Walters, Secretary for the Department of Children and Family Services. And members, we've had an intense 6 weeks since we met with you, and we have mobilized to attack what we believe are our three biggest challenges: the staff shortages, the rising and complex caseloads that we face, and the staff frustration with the working conditions and environment. So today we're going to talk about how we're addressing those things, and I'll get into the binder in a little bit. But it was clear in the summer that we were headed for a perfect storm with these realities. We were losing staff, the caseloads were crippling. As you know, we've said that over and over. And it was clear that we weren't going to be able to do our day-to-day operations the way we had always done it and be successful. Employee satisfaction plays a huge role in our work, and we recognize and acknowledge that we have staff that are unhappy, that feel like they have been treated unfairly, and have not had the opportunities that they should have had in this agency. And we are addressing that in many different ways. I mentioned to you, I believe last time, that I have asked Deputy Ricks to lead an effort that we're calling the Culture of Belonging, and she's going to share about that in a little bit. Last time we were here, Senator Cortez was with us, and he challenged us to open our thinking and to he used the words of Jim Collins in Good to Great, and get more people on the bus, get more people in the door. Look at how you're recruiting, look at what your qualifications are, and get more people in the door. And we took that to heart, and we're going to share more about that as well. We shared with you the 7 strategies, and then I believe at the end of the week, we mailed you some detail behind those strategies. I think in the hearing we just gave you the actual strategy list, and then we gave you more information after that. We believe that these strategies, at a minimum, are what we need to stabilize the workforce and to address the issues that are facing us, and will give us milestones to achieve that you can hold us accountable to and help us work toward. In looking at those strategies and looking at how big of a scope of work that was, it was really clear that we were going to have to make some changes to be able to do just the day-to-day operation of the organization and focus on those 7 strategies. That was way too big of a job or path for one person to do. So we had a long conversation, a lot of conversation about what the best strategy to do that was. And Dr. Hodnett is our expert and has been with us and knows this agency inside and out, and so we want her to have the opportunity to focus on the 7 strategies. So we brought back, and I want to emphasize that, this is a former retired child welfare director that loves this agency and was committed to helping us do better. And so Evelyn Jenkins has come to join our staff and will run the day-to-day operations while Dr. Hodnett focuses on the strategies. You'll get to hear from Evelyn a little later. It was also important to us members, especially based on what Senator Cortez said, that we needed to work with civil service to look at the qualifications of how we get people in the door, of how to hire more quickly, excuse me, than our normal hiring process. Our normal hiring process is bureaucratic and laborsome. And so we have been working very closely with the Civil Service Commission. In fact, they're here with us today to look at what our process is, how we can streamline it, how we can tighten it up. And in fact, we're meeting weekly with the governor's office, the Division of Administration, and Civil Service, bringing every effort to bear to make this a more streamlined process and to bust down any barriers that the agency was facing. I can't emphasize how much help that has been. We even have the National Guard helping us, and we've never had the National Guard help us outside of disasters, and so they are excellent strategists, and they are sitting at the table with us, helping us think through these strategies, and so that has been a remarkable gift. One of the things we've been able to do because of this is break down some of the time that it takes to move contracts through the process. Again, that's a kind of tedious and laborious process to move contracts. We have been able to execute in the 6 weeks since we met with you 10 contracts for additional services, and that are going to give us help in Baton Rouge and New Orleans. You remember, excuse me, members. You remember that we are using Baton Rouge as our pilot site, and New Orleans kind of in conjunction with that, and then we hope to move all of these things statewide. But we really have to focus where the need is the greatest, and the fire is still burning in Baton Rouge, and so we are using Baton Rouge as that pilot. One of those contracts, or actually 3 in one of those contracts, is an employee assistance program, which our agency has never had, that will serve the Baton Rouge, Lafayette, and Lake Charles areas. That is a region for us, and that's why we chose to do it that way. And we have providers that came to the table and wanted to partner with us and wanted to do that. Those contracts are now in place, and that has started to give our staff the emotional and mental health services that they need. A few weeks ago, kind of in the interim after our meeting, we mailed you a timeline. One of the things you asked for was a timeline of how we thought we would do this. The timeline is also in your binder, and we can go through it. I know it's little and it's kind of hard to read, and so we're happy to walk through whatever pieces of that you want to do. The binder itself, if I'm not going to go through it with you, but it has in the very beginning is the transition team report that was done for Governor Edwards as he took office. That report was very harsh about the condition of DCFS, and so when I was hired, the governor said, I want this to be your template for how you do your work. And so all of the recommendations so you have the transition team report, and then in blue ink under each recommendation by that committee that did the report, you have the answer of the DCFS response, what we have been able to do through up until now, because we updated it. Senator Barrow is familiar with this as a member of my advisory board. The advisory board has been tracking this transition team report with us for several years. I don't know that any of the rest of you have had the opportunity to see it, so that's why we included it. And it also gives you a good overview of all the things the agency walked in the door and needed to address, and how successful or not we were in addressing them. And then there are the 7 strategies that you have seen, that we have given you, and then the timeline that we mailed you. And then, members, under the 4th tab, there's a continuum of care. This is a basic child welfare 101. You're going to know a lot of this information. And at the bottom of each page, what we did was break down, sometimes we talk about child welfare like it's just one big lump of clay. And child welfare has very specific strategic components, like intake, like investigation, like foster care. And so this breaks down for you all of those things. It gives you some information about how we staff those, and it gives you a little bit of data or trend information. And then finally, it gives you some policy information if we've made any policy changes in the past few months. And it shows you how it aligns with the 7 strategies. So we will, as the chairman said, we will be adding information to this. There is also, under the 5th tab, all of the contracts that we have done thus far, where they are, the ones that are in the pipeline, what's pending, what's approved, and what they'll be doing. Again, remember that most of these contracts, although we hope to go statewide, are beginning in the Baton Rouge region. Before I ask my colleagues to speak, I want to hit a couple of more points. Recruiting and job fairs have been really exciting for us, and we have a handout for you. There's one tomorrow in New Orleans if you want to be able to go to that. We have held 2, one in Baton Rouge, one in Lafayette. But the attendance at the job fairs has been really significant. We had 150 people in Baton Rouge and 180 come to Lafayette, which gives us hope that people still want to work for this agency and believe in the scope and mission of our work. And so we're very excited about that. Excuse me. So far, we were able, what we're doing at the job fairs is we have everybody at the table. We're checking fingerprints there. Civil service is there, qualifying candidates. We've never done anything like this before. We have additional HR staff there with us, loaned to us from the division to supplement our HR staff so that we can interview as many people as possible. We were able to do 79 conditional offers between those 2 fairs. After we make an offer, there's still an awful lot of paperwork that has to happen. We're doing drug screen. We can't do the drug screen on site. We are doing the fingerprints so we can do the criminal history check. We have to check references, and there are a lot of processes that happen after the offer is made. So they're not all here and on board yet, but they're coming, and that gives us great hope. 32 of those were for child welfare. The rest were for the family support side of the house. Because while this committee is really focused on child welfare, we have a staff need in the family support side of the house as well, in our eligibility programs. We need staff there as well. We're also actively recruiting a position that was given to us called resident workers, that were people that we could hire very quickly through kind of an emergency standing contract that we have with emergency preparedness to supplement our staffing levels in Baton Rouge and New Orleans, where things are so critical. The most exciting thing, and I'm stealing a little bit of Dr. Hodnett's thunder here, but the most exciting thing is that we have hired 11 nurses that are helping take the substance-exposed newborns and going out and doing those investigations. Right now, they're paired up with our staff because they still have to kind of learn our process. But one of the things, again, that Senator Cortez mentioned was that we needed to think differently and look at a different kind of staffing and be more open to that, and we are. So we have 10 more nurses that are in various stages of onboarding, starting their work with us. They have had almost 100 cases assigned to them so far. They've done 55 visits. Over the weekend, and I thought this was interesting for you to hear, 31 visits were attempted over the weekend. 9 were assessed. 12 had the wrong address or the phone number, and we couldn't make contact. 10, nobody was at home. So even when we have the right exact kind of person to go and do the work, we can't always get through to the clients because this is something they're not required to do. We're required to go see them. They're not required to see us. It is very encouraging and uplifting that the young parents, these are young mothers, we're coming to see them when their babies are just days old or maybe weeks old. And they love having a nurse come in to see their child. They feel a lot more comfortable about a nurse coming to see them than they do about a social worker from the state. And so that's a really positive thing that we can't wait to expand. We also directed our home development staff in Baton Rouge to go to every foster home, document the conditions, check everything out, and 100% of those have been done. And then one final thing before I be quiet and let other people talk is I want to give you a glimpse of how we're treating this. DCFS has a huge role in disasters. And when a disaster strikes, we go into what we call a critical incident command structure. We take off our normal hats and we put on our disaster-related hats. And people have different responsibilities during a disaster. We have taken that critical incident structure and applied it to child welfare. We have war roomed this just like we do when we're in a disaster. We're down in our emergency operations center with people sitting at the desk so that we have everybody in the room that we need. We have it's a different way of looking at this work. The National Guard is there with us, hand in glove, helping us be strategic and thinking. Members, we have taken very seriously your admonitions and encouragement to get things straight and right. And we are doing everything that we believe that we can. We are open to more suggestions and more ideas because your ideas have been fruitful and helpful. And I am proud of what this team has done. I think we're all exhausted. I think some of us are kind of running on low energy and low fuel. But the outcomes will tell the tale. And our goal, our mission, our desire is to serve the children and families of this state to the very best of our ability, regardless of how many people we have to do that. We have been abundantly clear with you from the beginning that we need more staff. We are augmenting staff in every way we can. Some of these contracts you will see and hear about are staff augmentation for other people to do the work, because if we don't have the staff to do it, the work still has to be done. And so I will pause now and let Dr. Hodnett, although I took most of her thunder, I'm sorry.
Let's take a little pause. Any of the committee members wanted to comment, or you just want to continue to hear the testimony? We'll go ahead. You want to do that? Okay, we'll continue with the testimony. Thank you.
Okay. Good morning. Rhonda Hodnett, Assistant Secretary, Child Welfare. So as the Secretary said, there are 7 strategies that we've identified as core to stabilizing our system and then beginning the rebuilding process. Many of these have been in the works prior to this emergency, but we've been able to build out on them more, and this emergency has helped us to remove some of the roadblocks and the barriers that were just making it take so long to get some traction. So some of them are new, some of them have been in the works, and we're just continuing to move forward with them. The 3 that I wanted to really bring to your attention are related to the most critical pieces that the Secretary talked about, getting more people on board. We know that our staff are our greatest resource, that is where the service to children and families come, and that is the critical piece of getting people in the door and then supporting them once they're in so they'll stay in the door. We spend a tremendous amount on the effort to get people in and train them and invest in them, and we really need to have things in place all along to support them so they're able to continue this work. As she said, the hiring fairs have been great. It's a very big funnel, a lot of attrition from those that walk in down to those that we actually get a conditional offer to and make it through the process. But the really exciting thing to me is the time frame there. It used to take, on a good day, it was 100 days to get somebody through that process. And now we're down to about 30 days to get them through that process. So that is incredible. Now, of course, we still have all of the onboarding and the training that's required. We tried condensing the training, and the feedback was not good. They felt like it was just too much information. We needed to spread it out a bit more like we had been doing before. And so we're balancing getting people there and getting people there prepared to do the work. So we are going to make adjustments in our training model and make sure that we are adequately preparing people. We're also supplementing with on-the-job trainers and other people to go out with them so they are as prepared as they can possibly be to do this. Also, as the Secretary said, those other supplemental workers that we're bringing on, they are going through our training as well, so they're prepared to do the same kind of work that we're doing. So the job fairs have been great. The streamlining piece, which is outlined here as part of the strategies, has really been very, very helpful to get that time frame much quicker. The second area is around the growth and complexity. So we all know that during the pandemic, calls went down, investigations obviously went down, but the numbers are going back up. And I'll just give you an example. So it really mirrored the pandemic's impact. So in the investigations, in the last half of 2021, the average number of investigations per month was 1,406. In the first 6 months of 22, it jumped to 1,628 statewide. Since June, it's jumped to 1,940. So the progression of reports and that actually meet the criteria for us to have to investigate continues to go up. And so we know that both the number and the complexity, as you all are seeing in the news every day, the drug situation, the serious drugs, the youth violence, gang violence is just really impacting the cases that we're getting. And so the complexity of it takes a lot of expertise at the table to be able to serve these children and families well. One of the things that we're doing that you'll see in the strategies is this child protection team model. It's part of what was recommended by the Justice Department as a model to it was particularly designed for law enforcement's role, but it also outlined the role of other parties. And so we have been working with, in Baton Rouge to set this up. We're working with Baton Rouge Police Department there at the table, the Sheriff's Office, the District Attorney, the Child Advocacy Center, all of the players that have a common interest in this. And we're going to be co-housed with them at the Family Justice Center so that there is much greater opportunity to share real-time information, real-time data, to have access to the same information, whether it's law enforcement or us when we're working cases together, and to truly have joint investigations, not just parallel investigations where we're aware of what each other is doing and what they know about the situation so we can make sure that we're providing the best opportunity for safety for children and families. So that is a very exciting piece. It also includes the incorporation of something that Texas did where they brought in what they call special investigators, and these are either retired or people with law enforcement experience that they have hired as part of their child welfare staff and embedded them in their investigative units so that there is that understanding about, first of all, understanding of all that law enforcement has access to. So they are aware of opportunities to do certain kinds of searches, certain kinds of just access certain things that we may not be aware of. They're also a great liaison with law enforcement, and they're just another presence with our staff. So it helps supplement our staff. They also have a detective sort of mindset that helps us see things that we may have been looking over that they're picking up on. So that's helpful. We actually had people working with the Texas group and very impressed with it. Just a week ago, I was able to talk to some of the people there that said that it has been one of the greatest things that they've done. It has helped really training across the board, having them in there. And so that multidisciplinary team, having law enforcement, the CAC, domestic violence expertise there, substance abuse expertise, and our next big piece that we're working on now is getting medical and behavioral health people there. So we are working very closely with the managed care organizations. That's another one of the strategies in there that could be a whole session by itself. But we have interviewed all 6 of them. We have selected 3 of them that are very committed to working with us to enhance the services that foster children and the families we serve receive. And so we're going to be working closely to get more medical services available to us 24/7, to both us and foster care parents. The other strategy that
I think you brought up a few questions, so
Okay.
why don't you take a little hold,
Okay.
and we'll start with Senator Mizell. Senator Mizell, you first.
Thank you. Thank you, Mr. Chairman. So much content in what you're sharing with us. And, I mean, there's like, I don't know how many points. I love the nurses. I love the response for the job fair. And you told us to have a conversation.
No, I'd like this to be a working meeting.
I
A
agree.
working meeting.
So in that vein, we have come every committee and said, we want us to be a team. We all wanted the results you're sharing with us right now. I just have to say that with all the agony we've shared, and frankly, the tension, the news stories that it's our fault, good things are coming from this conversation that I don't believe would have happened otherwise. And I think it's really important that we allow an unpleasantness to get us to a better place. And I think I'm looking at the detail. I got a lot of detailed questions, like I want to know what the National Guard's doing. But at the heart of it, and when I look at our status, I just left a meeting on rape kits, and I'm like, we need to back up and rethink a lot of what we're doing. If we can step on each other's toes a little bit to get to a better place, then so be it. And I hope, I feel clearly that you all feel we've stepped on your toes. Frankly, the article today, I think we all feel like our toes have been stepped on. Okay.
Why don't you expand on what your thoughts are? 'Cause
I think if you saw the article, the legislature did not fund you sufficiently. Everything you're doing, you've been funded for. Mm-hmm. Everything you're doing, we funded you for. We could not help positions that were not filled. But if we're going to be a team, we're going to lock arms and struggle with the money and getting it done together. And I think that's what we've got to accomplish and leave here with that commitment. So with that in mind, and I just had to share that because I think that's at the heart of so much that holds us back. I don't want to step, Marquita, you and I have worked on a lot of things. But I'm really excited. I'm really excited about the job fairs. I'm excited about the hires. And but to get to the technical, okay, I purged myself of how I felt about that. When you said the hiring the process was cut from 100 days to 30 days, I want to ask you how, but more than that, I want to know, do you feel like you've got a less qualified employee?
I will say the jury is out. We will see, because we have cut the interview process significantly. We were using a model that has been used across the country, developed in University Child Welfare Training Academy in North Carolina, has been vetted and used well. That took about hour and a half or 2 hours to get through writing samples and just understanding the person's ability to think critically, their engagement skills with family. So it was very involved. This is condensing it down to about a 30 to 40 minute interview, still doing a writing sample, trying to put some pieces in place there. So we will see. I hope not, but we are working with the Blanco Center to look at the results that we're getting and figuring out exactly what we learn from it. I will be thrilled if we can get a good candidate in 30-minute interviews. I will be the first one to say, let's keep that up.
And just in the previous conversations we've had with previous employees or whatever, that to me is an incredible opportunity. I mean, I don't want to micromanage, but that's what we do. For a senior employee to be a mentor to these people who've only had 30 days training, that you're building, you talk about team culture. I saw team culture mentioned several times. That's got to start at higher. And that is just a tremendous opportunity to solidify a team culture.
Those on-the-job trainers, they're retired people who we brought back as WAEs, and that is the role they're playing.
And one other thing, and I know other people have, when you talk about the situation with the increased numbers, which is really disappointing, I would love at some point in this ongoing conversation for you to tell us opportunities that we're not taking to preempt this. I mean, I know the big picture is we've got kids who have no options. They don't have a high school diploma, the home, whatever. But I would love to know all those little areas that we could insert some reforms, something that would give us a better outcome that would address this direction. Okay.
Great. There are some things in here that are pushed out a little further,
right,
into maybe March of next year, so we can get through some of the most critical things. So I would love to talk to you about that.
Okay. Thank you, Mr. Chairman.
Thank you very much. Vice Chair Barrow?
Thank you, Mr. Chairman, and good morning, ladies. Good to see you this morning. I'm glad that I'm here. I'm so regretful that I wasn't here for the last hearing. But I have a lot of questions, and I was going to really save them to the end. But as you were speaking, Brenda, I really wanted to kind of stop you for a moment, because I wanted to find out the 3 MCOs that you guys have chosen, and I'd like to know who they are. Then I'd like to also know about this investigative team. That gives me a little pause in terms of some of the people who y'all mentioned and some of the issues I think that we faced in the past, or some of the resistance that we received in the past in terms of I'm going to use human trafficking as an issue, and some of the resistance that I think that we faced with law enforcement along this arena. So as you guys are selecting folks, what is the process in terms of evaluation? And how do you go back and look to make sure that it's actually rendering us the expectations that we are looking for? And then that was one other question that I had for you. But I'll start with those two.
Okay. So, Senator Barrow, one of the things, it sort of answers Senator Mizell's question also about the National Guard. So that is a piece that they are leading for us. That they're facilitating the conversation.
They are leading.
The Child Protection Team.
Okay.
So the assembling of the Child Protection Team, we are, they meet every week, and they are making sure that this is built together, that there's not one person who is in charge, moving it a certain way, that there is collaboration, coordination, that we are all on the same page about the goal, the mission, the purpose in this. I really think, in particular, because of the human trafficking things that are getting ready to really be implemented in January, that is a critical piece, that we're all together understanding these cases and sharing information about these cases. So I hope that that will really help instead of be any kind of detriment. We've had a lot of cooperation with them, so I'm very
Them
optimistic.
being
Baton Rouge Police Department.
the police department. Okay.
Department is Sheriff's Office.
Okay.
Both of them, their highest officials, met with us, sat down at the table, and committed to working collaboratively with us.
And so we know that this is the pilot, right?
Yes.
So I'm not really speaking to Baton Rouge in particular because I know that they've been very open. But we do know that there's been some hesitancy when you look in other parts of the state, right? So that's one of my concerns. One of the things I didn't hear that I think an individual I think needs to be included as a part of this conversation are judges who, and these could be retired judges who have worked in this arena. I would like to see someone like Charlie Zena from Tulane Institute, where you talked about the psychological impact and some of the psychological barriers or situations that occur, because you need to have someone who really deals, I think, and they can help the National Guard, right? Because the National Guard is familiar with, and I'm not going to just say not only, but for most part, infrastructure, right?
Right, Senator, the role the Guard is playing is they're planners.
Okay.
They are people that have been trained in Lean Six Sigma. They know how to do strategic processing, and so that's what the Guard is
So
doing.
they're the planners.
They're the planner helping us strategize, and they facilitate these conversations so that DCFS isn't leading it, law enforcement isn't leading it, the DA isn't leading
Gotcha.
it. The National Guard
Understand
staff
that.
person is leading it.
But I think we need to have some more people at the table. Some of those folks that I mentioned who work directly with the children, who see them or have seen them, I think needs to be a part of the conversation. So they are the planners, and I get it. And they're good, and they're excellent at doing that. But we want to make sure that we have some of the other folks that need to be at the table. Yeah, managed care organizations.
Yes. So, Aetna, Healthy Blue, and United Healthcare are the three that we've selected that we're going to be working most closely with. We had, as I said, we had meetings with all 6 of them. We then had another meeting with the 3 of them to talk to them about expectations that we have and to try to figure out how do we get better service, how do they help us to develop, I guess, a subpopulation of providers that will specialize in working with our children and families, that will be available and accessible to us at times when we need it. Just a quick example is the ability to take a child who comes into foster care for an evaluation, a medical evaluation, quickly. Workers are having to wait way too long to get that in place. And so having an arrangement, an agreement with a subset of providers who say, I am willing to be accessible and available to you whenever that occurs in this particular area, and having that across the state. So we're talking about mobile crisis for adolescents. So there are several things that we've identified that we think will both be some savings to them, which we hope will further incentivize them to be at the table and thinking very creatively, as well as help the children and families that we need helped.
Aetna, Healthy Blue.
Aetna, Healthy Blue, and United Healthcare.
United Healthcare.
And
Do they have the
Senator-
largest footprint in Baton Rouge?
We did look at that when we selected, so I can send you the information on it, but they all have sufficient footprint. Aetna is new to the table.
Right.
They had not been one of them, but I'll tell you, they really came to the table in a way that said, we want to partner with you, let us know. And we do have judges that are part of that conversation. Judge DePlanche is included on our meetings with them to offer a judge's perspective about the needs that they're seeing as well.
Okay. I know that Louisiana Healthcare Connection has the largest footprint in the state. And I'm not quite sure in terms of the criteria that y'all may have used, but I'm just, maybe that can be an offline conversation. And just
So is that the Healthy Blue Group? I think.
No.
Louisiana
I don't-
Healthcare Connection. Let me check it.
They have the largest footprint in terms of MCOs in the state. So it's interesting to me that they are not included, but maybe y'all have some kind of rubric that you use to make those determinations. I will have a question later on, Mr. Chairman, for civil service as we are going through the process, but I'll stop right here. Thank you.
What we'll do, Madam Vice Chair, is after the testimony, we'll call upon civil service, or at any time you want them on the table. They are here in attendance.
Thank you.
Thank you very much. Senator McMath?
Thank you, Mr. Chairman. I'm going to go back a little bit to what I think my colleague, Senator Mizell, was alluding to in regards to this article that I woke up to at 5:30 this morning. It was unfortunately the first thing that I read. Louisiana is flush with cash. Why is child welfare still woefully underfunded? Basically, the premise of the article is can be summed up by a quote from a Baton Rouge judge. Let me find it. Talking about his prediction of child's either being abused or dying in the care of or supervision of DCFS. Quote, and the legislature is going to be mad. They're going to call hearings. But they're at fault for woefully underfunding DCFS. It goes on to include some stats and information, most of which revolves around 2014, 15, and 16, 7, 8, 9 years ago. Clearly not when this administration was responsible for the cuts that the department underwent, and right at the beginning of their taking office. Again, 6.5, 7 years ago. And then it goes on to talk about how the legislature the past year or two have been flush with cash, and a lot of that money coming from federal coronavirus, COVID aid, and all of the things is the reason why we've been able to send significant amount of dollars, 100 million or so, to quote-unquote pet projects within our district, ignoring the fact that that's one-time dollars and would be woefully irresponsible to fund recurring expenses, but we don't need to worry about that. But the theme was, again, that legislature on us for not funding DCFS properly. And by the way, this is not geared towards you, and I'm gonna finish more on a positive note. So just bear with me. I had staff, in response to this, run through, just do a quick search of the 5 most recent articles regarding DCFS, because I was a little confused as to why in this article there's not a direct quote from Secretary Walters or anyone from DCFS. And sitting here, I've realized that this has nothing to do with you. Did anybody reach out to your office in regard to a quote for this article?
We were interviewed and provided all sorts of financial data. And yes, I did interview with the report.
Okay, well, they didn't include your quote in here. So, but just to go through, kid raped by foster parent, deputies say is shocking arrest, DCFS at the center of a new controversy. I believe Secretary Walters provides a quote in this, or a statement. The investigators, DCFS previously involved in the mother charged with murder and child's hot car death. There is a statement provided from DCFS. And this one, lawyers plan to file a lawsuit after toddler's deadly overdose will focus on DCFS. I did not actually see a quote on this one or a statement from DCFS. Again, much like the one that we read today, the investigators, DCFS confirms active case involving death of Navia Allen. Obviously, you've confirmed that, so you provided essentially a statement to the news media, DCFS employee describes morale issues challenging of working for the agency, something that we all heard last time we met, and the countless emails that my office has received in regards to child welfare workers and what they see as the real problem is not necessarily pay, but the environment with which they work in. We all heard that last time, and there is a quote from you, Secretary Walters, in this. If I can, I would like to. I also had staff do a little bit of research, and I appreciate them doing that at such short notice. But I had them pull up in order to maybe make this more of a complete story, a quote from Secretary Walters from the DCFS presentation to the Finance Committee on the budget from March 17th of 2022. So this is a direct quote from Secretary Walters. Our budget, quote, our budget is really very adequately funded. We are stabilized. We are making market rate adjustments on salaries. And she says, where we hurt is human beings to do the work. Again, consistent with the testimony that obviously we've gotten today and the actions that you've taken to address that. And the testimony that we received the last few days. If you're interested, the DCFS presentation by Finance starts around minute 33. But Secretary Walters' statements are an hour and 13 minutes if you want to go back and look at that. Listen, this doesn't help. And I know that this is not for you guys. We're all here, as my colleague Senator Mizell said, to try to address the issues that that DCFS and the children that are in that care, in your care, have unfortunately experienced over the last, several years. I want to, one, help complete a story that was probably written incompletely, and really it was a pretty cheap shot at the legislature. But more importantly, much more importantly, is to say thank you for taking our information and our put seriously and doing the things that you've talked about today. Admittedly, being candid and honest, it is frustrating that it has taken, some years to take some of the actions that you're taking. I mean, Secretary Marquita, you said it yourself. You're doing things that you've never done before, and you're doing it because you have to do it, and you're doing it at the urging, I think, of us, and that's our responsibility as legislators to have some oversight and to push where and when we see fit, mostly motivated by the input that we receive from our constituents. But I want to say thank you for doing, taking the action that you're taking right now to try and address the issues, allowing me to vent this morning. Again, not at you, but and look, I'm a freshman senator, and so some of these folks that have been around for a little bit longer are probably used to media reports that are either incomplete or distorted or just not helpful to what we are up here trying to do and what you guys are wanting to do and taking the action that you're taking. So thank you for that. Thank you, Mr. Chairman, for allowing me to.
So what you're saying is that you're not going to nominate that article for a Pulitzer Prize? Okay.
No comment.
Senator McMath, as somebody who has recently been in the press a lot, I understand your frustration. And members, I want to be clear. I hope and believe that I have been transparent with you for 7 years. I have come to the table in every committee hearing telling you we needed human beings, and I unapologetically, because of the cuts that the agency took during the previous administration. That's just true. We're a human service organization. You can't do this work without humans. Our budget has grown year over year. I think that data is, I haven't read the whole article. I will admit that. But we are very clear that our budget has grown. Our budget has grown in technology, huge investments in technology in this agency. It has grown in services that previously the department had to absorb. Rent. Cost of living has gone up. Everything is more expensive. In previous years, those kind of things, when the costs go up, the department is just told, you got to absorb that. We were given the money to pay for that. The raises that we have been able to give, working with civil service, getting the approval to give raises, because, I can't just decide to raise a salary. Trust me, had I had that authority, that would have been done 7 years ago. But that's not how this government system works, which, by the way, coming from outside of state government, is constantly a sore spot for me. I'm used to private industry where you can make decisions differently. All of those things have been funded, and we appreciate that, and we acknowledge that, and we've always appreciated and acknowledged that. I am grateful, as much as it has often been painful and felt personal. I am grateful for this committee and for the oversight. I do want it to be a partnership. I shared with a couple of you, I believe, that when I was working for the state of Utah, they had an oversight committee that came out of the result of a bad case. It started very acrimoniously, wasn't really a pleasant thing. It turned into a wonderful partnership where the committee met with the department and really often met outside of the public arena so they could really dig into data, into cases, and to learn the agency truly well. And then they are the spokespeople for the rest of their counterparts who don't have the luxury of digging into each agency. There are 20 of me for y'all. You've got to learn an awful lot to try to make good decisions. And I do appreciate this committee's oversight and this opportunity. We are doing a lot because you have said you need to do more. I want to be clear, there's a lot of it we were doing before. And I also want to be clear that if you look at the transition team report that shows what we walked in the door to, and you look at our responses that we highlighted in blue so they'd be easy for you to see, you will see what we've been doing for 7 years. Because members, we've not been idle waiting for y'all to get mad at us and tell us to get to work. We've done some significant, extraordinary things in this department that we're very proud of, that we've received national recognition for. And so I mean it from the bottom of my heart. I want this to be conversation. I want this to be work together, because you're going to see it differently than we see it, because we're in it, in the weeds every single day. And it is very helpful to have fresh eyes and eyes that aren't burdened by the depth of horror that happens in humanity to children in this state that we are dealing with every single day, talking about waking up at 5:45 in the morning. Those are the things that wake us up in the middle of the night. We need you. We want your help and your attention. And if I have ever given the impression that that wasn't true, I apologize, because that is my belief. We are better together. I'll stop there.
Thank you very much. And I'm getting ready to call on Senator Pope. What I'd like to do as you complete your presentation is just to be thinking about it. There's 7 strategies that are in our book, and you have the 7 strategies basically outlined with timelines, maybe levels that you've completed, levels you're working on, dates you hope to accomplish. Maybe we'll do a quick overview of that. And what I'd like to do from the committee standpoint and your department standpoint is this template will be the document as we meet between now and the end of the term of this committee. Because I think if there's a critical point that you say in the date of achievement is January of next year and we're nowhere close, that's the conversation. You know, that's the conversation we all need to have. Why is that not happen? What's the obstacles? Where do we go from here? So what I think the goal of this committee is, it's good to hear the goals and we want to hear it, but I think it's going to really break down to, are we achieving those goals? And we're achieving the timelines? If not, what's the obstacle? On that note, Senator Pope, it's all yours.
Thank you, Mr. Chairman. And y'all just have to bear with me. I wish I was as sophisticated as Senator Mizell, as articulate as Senator McMath, but all of you know that I don't have much to say, but today I got something to say.
Well, it's all yours.
And
there's not a
I'm
shot
not sure
clock.
how it's going to come out, but I'm going to say it. And I apologize in advance. First off, let me just say I appreciate y'all's work more than anybody knows. I understand what you're going through, having been on a distant part of that, but I also understand that we've got frustrations, and I haven't said a whole lot up here, but I got frustrated this morning, and I'm not going to pile on what's been said about what the article was in today's paper, but that probably upset me as much as anything I've seen in a while, and that is the fact that we're going to right now have, 300 vacancies, give or take?
Unfortunately, it's a little more than that, Senator.
Yes, I said give or take. I'm just picking a small number. So we got those vacancies. Yet I also read in that article where we're going to ask in the next budget cycle for 250 more spots. Now, if money is going to solve this problem, I think that we can find the money. But money's not going to solve that problem. I could give you all the money you wanted, and you still got 600 spots that you're looking for. Is that correct?
We are working every day to fill that. I know.
Look,
Yes, sir. Yes,
I don't want to
sir.
interrupt you.
Yes,
I know
sir.
you're working. I'm convinced of that. I'm convinced of what you're doing. I appreciate what you've done up to this point in time. What my point is, the fact is that we could give you all the money that you wanted. You still couldn't fill those spots. You're trying. You talked about a while ago, you did, about the fact that we're going out, we're doing job fairs, we're cutting it down to 30-minute interviews or whatever. We don't know the outcome of what kind of employee that has. I've got some issues with some of those people too, I'm going to be honest with you, about the consistency of what goes on in some of these places where we go out and we look. And it happened in my district, so I know firsthand what I'm talking about. I'm going to get into that. That's another story. But we've got to have consistency on that with the employees that we've got now. I digress. I'm sorry, but that's where we're going. You understand? I just have that, so I don't want to jump on that. I have come to the conclusion on the way over here this morning, though, that, one of the things we may have, and that I don't see anything in here that hadn't been brought up, and I'm going to bring it up today. And I don't know if I'm going to pursue it or want to pursue it or have further discussion about it. But I'm not sure that this agency is not too big. I'm not sure that we don't need to break it up into smaller silos so that we can have a better understanding of what's going on so that everybody can get a better feel. Not that you haven't done a great job. I applaud your job. That's not what I'm doing. I'm not looking to try to replace people or do anything else. But you sit there multiple times, and I've heard you say that this job is overwhelming. It is. I understand that. Maybe it's time that we look to try to break it up in smaller groups so that we can have a better feel of what's going on, and we can have, instead of going 15 steps up the ladder, we can just go 5 steps up the ladder to get somebody that's in charge. You follow my drift? Probably not, but that's where I feel. I haven't been there on that. I just feel like that there's more that we can do. I applaud what you're doing, but I think that there's more that we can do. Our job is to have an oversight committee. That's what we're trying to do, trying to make things better. One of the ways I think we might be able to make it better, in my opinion, and I'm going to look at it strongly, I promise you, I'm going to tell you up front, is to break this thing up and where we can't break this department up into smaller issues. I think it's too big. That's all I got to say at this point in time.
Very good. And look, I encourage the members, this is a working meeting. This is not a piece of legislation we have in a debate. So this is a good working meeting. On that note, I'll turn it over to Senator Luno.
Thank you, Mr. Chairman. Recently somebody made a comment about me that I overheard, and they said I was a bull in a china cabinet. and I really didn't criticize them for it because it's probably pretty accurate. So I'm just gonna put it out there like it is. During the Jindal administration, in his last years in office, they drastically cut this department. It was untenable. You couldn't do your job with the amount of money you've had. Since that time, when I came in office, when you came in office, Madam Secretary, when the administration here, many of us in here, we worked diligently and advocated for the department and got the budget back up to a reasonable level. Have we give you every dollar that you've requested? No. I don't know of any department that gets every dollar they requested. But when we have an article that comes in that's horrible timing, when we're all working so hard together to try to right this ship, to say these things and to quote a person with apparent authority of what, an understanding of what goes on, to make a flippant comment that at best is inaccurate and at worst is intentionally inaccurate, to say that we're not funding the department in an adequate amount, it defeats everything we're trying to do. And it's poor reporting. I mean, that's all you can say. They don't lay it out and say what happened and how this really worked. Let's just say it. It's the truth. Let's say what's up there and don't try to sugarcoat it. It was horrible. We're trying to fix it. You're trying to fix it. Everybody's working really hard. I'll take part of the responsibility because since I became chairman of labor, unemployment is the lowest it's ever been in Louisiana. That's my fault. I did a great job. I'm sorry for that, but we'll try to fix that. And I say that tongue in cheek, but the fact of the matter is this is not just an issue with your department. This is what's happening all across the state and many places in the nation. When we went through COVID, it changed everything in our lives. It changed everything in the market. It changed everything in how people work. And we can't stop what you're doing because of all that. We have to continue to go. I too am going to join the bandwagon, applaud you guys and what you've done. You worked really hard. There were some serious problems. We all acknowledge that. Everybody is working together. Why don't we, our friends in the media, come in and say, hey, there's some positive news here. I tell people all the time over in Texas when they say, we have potholes here, but they're the biggest and best potholes in the state. Well, we don't do that. We accentuate the negative every single time, and I'm sick of it. Let's talk about the positives a little bit, and let's move on, and let's try to correct the negatives. So I'm going to get off my soapbox now, but thank you. And Madam Secretary, I just wanted to point out, this article wasn't you. You didn't say these things, but it is very frustrating. I join my colleague, Senator McMath. It's incredibly frustrating when we know what we've done, and it's not reflected at all in what's reported, and that's unfortunate. I'll stop now, Mr. Chairman. Thank you.
Of course, I see WFB TV. It looks like you're doing good. Keep it up. All yours, Senator Barrow.
Thank you, Mr. Chairman, for giving me another bite at the apple. And I feel that I would be remiss if I didn't make some comments behind my colleagues' comments as it relates to the budgetary issues and what we've been through. So I was one of the members who was here, along with you, Mr. Chairman, with many of you guys that was here during that time, and suffered great trepidation. First argue was at the well, trying to defend, trying to make sure that these cuts did not happen under the last administration, under the Jindal administration. What I just want to mention here as we go forward, because one of the things, and one of the questions that I do have that I'm going to ask later, because as I looked at the your chart going forward, and something I saw about something being maybe temporarily ended in February, is how do we sustain this? So what I want to say to my colleagues who may be coming back under the new administration, because this governor has done everything he could possibly do to try to make sure we bring the department back, try to shore it up. All of us working here have been supportive of those measures. But when the new administration comes in, is what I want to talk about going forward, because I don't want to see us go back to those days. And really, we have not really recovered. We are in recovery. We have not recovered from those days. I don't want to see us go back when the new administration comes in, and I'm putting this on the record going forward, because at the end of the day, this is the agency that has the on hand, have to be on hand with the people that they come in contact with. I often say, and have always said, that you guys are the heart of state government, because what you do impacts the whole being. Every department is important, but what you guys do impacts every facet of every person. And so as we go forward, members, as we are working really hard to ensure that we are bringing this department back, that we don't take steps backwards in the next administration. I've heard a pastor say once before that sometimes your adversary serves as a great tool to move you forward. And so this situation has been adversarial at times, but it has propelled us to move in a better direction. And so I believe that we are moving in the right direction. I applaud you and your team for coming along, doing what you can, really taking those aggressive steps. You know, you say y'all in the war room every day, that you're really looking at what's going well, what's not going well. That's taking a lot. But it was the adversarial piece, right, that may have pushed you to that point. What I don't want to see happen is us regress. When this administration is over with, and when the new administration comes in, and everybody wants to talk about cuts, let's remember that we don't cut this department. That's what I need to say.
Very well said. Thank you. Senator Hitchkins?
Thank you, Mr. Chairman. And Mr. Chairman, I'm not going to go on the record and say the local media blew it this morning, but we whatever. Doc, we got through the first two strategy points. The third one's about high-risk infants and toddlers. And our decision tree blew a high-risk situation earlier this year. And so I want to know what the detail is. What did we change in here? What did we change to make sure that we don't do that again, that it's not because someone took a vacation or anything else after 3 notices that we get this thing right and we get it flagged right? I mean, this one's very important to me, so could you explain it to me?
Sure. There are several things that we've done already. One is we made some policy changes around reports being accepted from medical providers. So if a child 3 and under is reported by a medical provider that there is abuse and neglect suspected by a parent or caretaker, that report is accepted unless it goes through multiple levels where a manager overrides it. And the reason that is important is because right after this hearing, we stopped it at it just accepted. If a medical provider makes a report of a child 3 and under, we accept it. And we were bombarded with reports that really did not meet the criteria of abuse and neglect. They were reporting things that were, one example I asked for was concerned because the child had COVID and the child may not be taking the medication, or the parent didn't want to get them the vaccination. So things like that really did not, it took time away from us being able to respond to the more serious cases that we must respond to. So there had to be some assessment of the reports and ability to make a decision on that, have some discretion on them. But I will tell you, they're very, very tight on that. So we have taken many more cases that involve young children. Another area that we're working on is the nurses. So making sure that we understand the kinds of things we're looking for in young children and making sure that we're attuned to that. It's not just looking at the child and saying, I think this child looks well. It's contacting the pediatrician too, verifying the care of the child, really understanding what they're looking for in developmental stages of a child. So that's another piece that we're incorporating into there. We have put, especially in the Baton Rouge office, because they are so understaffed still, we have so many temporary people in there. We have put several layers of supervision staffing around cases. So it's a safety wraparound model, basically, where people are doing a pre-investigative plan. So when the report comes in, there's a supervisor who is brought in to work particularly in that office that is making sure that the plan of the worker who's going out is comprehensive and thorough, and everything is understood of what they need to do. There's a plan when they're back, looking at that safety plan, which has always been a part of our work, but the closer follow-up on that. So multiple things done there. Trying to see some of the other things. We are, as part of our Families First initiative, there is a program called Child First, which is specifically designed for young children and their families. It's an intensive in-home service program. We are implementing Child First in several areas of the state, and one will be in Baton Rouge. That we're hoping will start in January. So multiple things that really focus on the very young children. That is one of the things that has come out of the Commission to End Child Abuse and Neglect Fatalities. One of their recommendations is a much closer look at children 3 and under. Obviously, they're the most vulnerable, and as Senator Mizell pointed out earlier, there may be opportunities to intervene before we receive a report that alleges abuse and neglect. So how can we identify some of these families up front that really could benefit from some services and not get to that point?
No, thank you. I mean, that was obviously a shortfall we had, and it sounds like y'all have got a lot of things in place to cover it, and so I appreciate that work. That's all I have, Mr. Chairman.
Thank you very much, Senator. I guess on that note, before we turn it over to Senator Mizell, you know, from you can't. There's certain things that just happen, but from a high-profile situation, we've seen some high-profile cases that we won't talk about those specific cases. But from the guardrails you've put in place and from what you talked about, do you feel more assured that we won't be seeing these cases in anytime soon? I know there's shortages, but there are internal controls, and we have to live with what we have. Do you think those type of situations have been mitigated to prevent that again?
I think that we have multiple strategies in place to prevent the likelihood of this happening. We can never.
You can never do it,
guarantee
but you feel
do
you've
feel like we have-
mitigated the opportunity that could happen again from the problems you had?
I do. And I would just say to keep in mind, first of all, the much of the information that is known publicly about the cases is what has been reported in the media. And just like this report, perhaps everything is not
Sure.
known or being reported. So there's always more information that might round out or provide more context to the situation that could have it look very different. So I will say that first. And many of the, at the bottom of the line, many of the families that we touch early on are at very high risk for.
But I guess what
for
I'm saying
outcomes.
is
we have things in place as, yes, we've tightened everything we can possibly tighten to the greatest extent possible. I am just so cautious of saying, this will never happen
No,
again.
I understand. I guess what I'm saying is lessons learned and
Yes.
you mitigating it.
Yes.
What would you say is that one most mitigating factor that you've implemented that at least we hope and pray this never happens again?
So I would say probably the tightening up of our intake, so making sure that we have a supervisory level oversight over every decision that's made at intake. A real emphasis on the fact that when a report is not accepted, when it's called in and our intake staff determine that it does not meet the criteria, it is sent to the local office, regardless of it accepted or not accepted. It always goes to the local office. There's a second level review. And I believe that the emphasis that we put on that second level review and saying, here's some more eyes on this. Is there something we might have missed? Should we have taken this? Do I need to send it back? And a process that's reviewing that. A QA process that is more intensive in those cases. And then just the constant awareness of our staff. I do believe our policies were solid prior to this. Our practices, we had them reviewed by multiple entities. It's the ability to carry it out and have enough oversight with supervisors and people who have good clinical decision-making skills to be able to do it, who can read between the lines. The information that someone gives you can be very, they will tell you what they want you to hear. And so you have to be able to know how to look behind that, reconcile conflicting information, determine when there's a direct contradiction. How do you weigh that, and where do you give more credence to information? So I do believe we have done. If there was anything else we could do, I would have done it.
Understood. Thank you for the answer. Madam Pro Tem?
Thank you, Mr. Chairman. Thank y'all. And this is not where I was. This didn't make me press my button, but when you're saying that, I was in an early childhood meeting yesterday, and same need. Early childhood can't get workers. Hospitals can't get nurses and doctors. Corrections. I mean, you can in every direction, but in a very creative way. I don't know if anybody's here from the workforce, but the workforce has kind of created a situation where, with the community colleges and high schools, are going to kind of create a opportunity for dual enrollment and kind of a ladder to. So you all may already be doing that, but I think that's something we really need to take advantage of. I want to go back to what you said with Child First. Child First, is that a contract? Are they?
Contract,
so it's
yes.
temporary. And I don't want to put words in your mouth, but I'm going to tell you my impression. It's a nurse-family partnership, right? Is that a nurse-family partnership?
It's a clinician, a mental health clinician, and a coordinator, a resource coordinator. So it's a team of two that works intensively in-home with a family with a young child, primarily those where there's substance abuse.
And I don't want to get in your head, but my impression is that you all brought that in as a new contract to fill kind of a fill gap. Okay? So when that, in this dream world we're building, when you have employees, will they, because right now, Child First comes at the point of a call.
Child
What
First.
what causes, and this is where I'm going. When they finish what they're doing with you now, are they going to be able to take a preemptive role for a parent before the call is made to DCFS?
Well, of
Because
course-
this is where we've got to go.
Right. So that is what Families First Prevention Services Act of 2018, that is the whole emphasis of that act, is getting upstream. How can we put things in place before it results in a child being abused and neglected? So that is the emphasis. The first step that the feds made is upstream in the child welfare system. So they're still coming to our attention. They're still going through an investigation, but we're
How
intervening.
do they come to your attention?
A report. So we
From
still are receiving a
somebody,
report. of abuse and neglect.
something. There
Yes.
has to have been an incident, or the neglect has already had to happen. But okay.
For Child First. Now, we'll
Right.
say, if you will see one of the initiatives here, the My Community Cares initiative, are you familiar with that? So we have a resource center, a family resource center in every region of the state. And as part of our federal plan that we did after our reviews that the feds do, we instituted in partnership with the Court Improvement Program and others, a program called My Community Cares in 5 parishes. And it's a real grassroots effort to provide services to children and families before we end up having to intervene through an investigation or further down in our system. It has been very, very successful. And so we have just expanded it in contracts that are starting in October. That was in the works. The contracts were going in October. And so it is expanded to be in one parish of every region that has the highest rates of reports to us. And so we're looking upstream to try and see how can we have a presence in those communities where we're actually partnering with an entity that is a trusted, well-known and respected among the community for being able to provide resources, guidance, support. And so the goal is that people, kind of that no wrong door, right? People can walk into there. We have a navigator there who, if they don't even know what they're asking for, but they're in trouble, they know that they're They don't have enough money to pay their rent. Their kids are they're afraid they're using drugs. Whatever problems, they're in a domestic violence relationship. They can go there and say, I'm in some trouble. I have some problems. I need help. I don't even know what resources to ask for, but things are not going well in my home right now. My children are at risk of something bad happening. That person helps them walk through a situation, does an assessment with them, and helps them understand what resources might be available to them. That's all before they come to our attention.
And what, and I know I don't want to get too deep into it.
I'll be
but
glad
I'd love
to
to know
spend
what
time with you
triggers
about
them
that.
to be aware that resource is there.
They're doing a lot of public awareness in the communities.
Okay, because I
let
find,
families
especially
know.
if it's the only location in a rural parish,
Mm-hmm.
if it's more than 15 miles away, they're not going to have transportation to get to it.
Yeah.
And that's another that's another issue. But really quick, on the critical incident reviews, this Casey, the article, are we measuring, like, I think what they were looking at were the results, the recommendations, the impact. Are we getting measures, all the programs you're talking about, the community, when we start with Child First, I think it's really important that we know, we've got to be aware of what's working, what's not, what gives us the best return on our investment in it, and put our money toward expanding that instead of just throwing everything against the wall, which sometimes, frankly, when you put all these different guidances in here, I'm not sure if we're just trying to find something to change outcomes, which is that we do that. But I'm hoping that by measuring the results, we're able to kind of like fine tune what we're able to do and what we can invest in and have some confidence in. So are you all measuring?
We are. It is part of a requirement under Families First that there is an evaluation component. And again, we're working with Blanco Center on that. So yes, we are measuring. Child First is a parent organization. They are connected to Nurse Family Partnership, and they have a certain set of metrics that they review regularly with us, as does Youth Villages and the Intercept program. That's the other part of Families First that we're doing. All of them have an evaluation component to it.
And if I might be so bold, if we could be on that mailing list, if we're going to continue to be a team, and if we're going to continue, as Senator Barrow's looking to the next term already, if we're going to continue this, give us the successes, but give us the reality. We don't need a pretty picture. We're used to dealing with unpleasant things, but we got to know the reality, and I think that's going to help us get to where we all want to go. So anyway, thank you, Mr. Chairman.
Senator Mizell, if I may, I think my deputy secretary is just going to have some kind of trauma over here. She doesn't get to answer some of this.
I'm done.
There are several points that I know that Terry would love to make about the Unite Us 211, how we're working with the broad picture of No Wrong Door, and I'll stop there, Terry.
Thank you. I love that Renda brought it up in that perspective and talking about No Wrong Door. In everything that we're doing, the focus is, right, quality care to children and families, right? And so when we're talking about the employees, we're talking about getting people on, and we're talking about services, and I appreciate you bringing it up that way. The other side of the house that we currently have right now, Senator Pope, right, is also economic stability, right? And I've never seen two assistant secretaries work so hard together to make sure that when the other side of our house, assistant secretary over family support, is working to make sure we can stabilize families, find people the right types of jobs that will give them a living wage, support them along their journey, their pathway, right? Give them education and training opportunities, which we are increasing under the secretary and with the assistant secretary. That is really our prevention services, right? Because the largest amount of people coming into the care under RENDA services are families that are not stable, right? They're not economically stable, and then crimes of passion or despair and other things happen, right? And so it is important, Senator Mizell, that what you brought up. If there's just one center in the center of one parish, of one region, we're not going to win. But we've been partnering with the Louisiana Association of United Ways, that basically is the umbrella organization for the 211s, right? And just as a reminder, if anybody has forgotten, if you pick up the phone at any time and call 211, you're going to actually get a person on the other end of the phone, 24/7, 365. They're going to talk to you about what concerns you have, what kind of resources do you need, do an assessment, and actually give you resources. We've had an increasingly good relationship with 211. And this year, in January, that was shored up in a very healthy way. We have a cooperative endeavor agreement with the Louisiana Association of United Ways for the use of 211, and every person in DCFS has a license to actually search the database itself, not even having to call 211, but we also can tell our clients, call 211. If you can't reach us, call 211. They can give you resources. And now we're rolling out, stepping out, how to put that into our everyday work with clients, finding resources for them. But the other part of that, in addition to getting the word out far and wide to all Louisianians to remember that at any time you can call 211, is that what we requested of 211 was to also have what we call a closed loop service delivery or referral process. And that works like when you go to the doctor and he tells me that I got to go to physical therapy. Before I can call them, they call me because I probably forgot, right? Doing all the work, right? Anyway, I forgot. So they call me, and then I get an appointment. So that's a closed loop referral, right? And so that is a game changer for clients. That means, Senator Mizell, if this family is already identified and working with one organization, they can send a referral to other resources, and then each of those resources can actually see what's happening with this family, and we now have data points that those of us, we can share together to actually show that the journey of this family, of this client.
So are you using that now, or is that?
We have started
So you're
using it.
using that with the 211?
We are using it. So 211 brought that service delivery module to the table for us. And so in the department, we have begun to roll it out. And so the one part of our agency that is 100% using it right now is our STEP program. That's the TANF work program that has a very intense case management part, wraparound services to be able to help somebody on a pathway with employment and training. But it's also about to roll out in December for all of the child support enforcement, and soon after that, the SNAP, and then soon after that, different elements. And so someone mentioned earlier about diversion, like how do we divert somebody from ever making the call that Renda has to take and then determine. So we believe this is diversion, like if we can get, and this, what's important about the Unite Us, and that's the closed loop referral system, that is coming from the ground. We're joining a table already set by many people in the community so that a client, a family, they don't really care who they're getting the services from, right? Whether it's a state agency, a federal program, or a nonprofit. So what's important is that the state should not be looking down on organizations like, I'll help you join us, like, let's all sit together at the same table and help this family. So a family would have to say, the person that they're talking to would have to give their permission, yes, please work together to help me, and then we'll be able to do that. And one of the most important things about that is that we will be able to finally use data to show where we have unmet needs.
Right.
Right, and that's important because right now we do it anecdotally.
Right.
But when we're able to have data around someone's entire journey, you also get to figure out what happened well that this person had
And
the
expand on
outcomes
that.
that they wanted.
Right.
And then where are we missing critical services? Then we can also hold hands together to try to figure out how to resource that, how to bring either state resources to it, federal resources, get grants, et cetera. So this is super important to us. And so the partnership with 211 has grown over time. The one thing that we saw coming out of the floods of 2016, and the secretary allowed us to bounce back from this, is we hosted in 5 different parishes these children and youth boards for recovery. And every parish we went into said, we need to know where the resources are. And then it's just like we forgot that 211 existed. Under the Blanco administration, the state actually gave 211 $750,000 every year so that the 211 system could actually work. And work well so that people would know where to call. We lost that over time, but I'm so excited about the fact that we not only regained it, 211, and providing resources for it, but now we have this closed loop opportunity which will allow us database. We can understand equity, we can understand where there are unmet needs, et cetera. So this is an exciting rollout for us. I think that it's going to be able to bridge the gap between how do we let one agency know about a family who needs services and where do we come in. This is a true no wrong door.
But is the 211 available only to services under your umbrella?
No, ma'am.
So if somebody needs a high school diploma, they're going to be able to go. So it's a far-reaching
Yes, ma'am.
opportunity.
Yes, ma'am. All services
that's-
for families and individuals. And here's the thing. There are sometimes a service that pops up in your area that 211 doesn't yet know about, right? Because they hold people, they hire them for the sole purpose of looking for resources and updating resources. So our commitment, and we can have this commitment as a state, is that when we find something, we want to make sure that 211 has the right information. So it goes both ways. So we update it with them when we found something that they don't yet have, and vice versa. But to be able to have what we thought, you might remember back in the day, Senator Barrow, Senator Mills, neighborhood place is what we started calling No Wrong Door. We had to have everybody co-located. It's just not possible, really, when we only have offices in not even half of the parishes, right? And so this, though, allows that to happen using technology and using the web. And by the way, it is free for nonprofits to use. And so the Unite Us platform is showing amazing promise. As a matter of fact, the secretary sent 3 people from DCFS down to Florida, right, to make sure that they can help with the storm services. And we see them doing some of these same things, as well as North Carolina and some other states. But this work we're finding is also invigorating the staff. They want to be able to help people more than just saying, yes, you qualify or not, right? And so one of the things and some of the qualitative feedback we've gotten back from staff is that I want to do more than just the minimum. I want to actually help this person that's in front of me more meaningfully.
Because you know what? You have an opportunity when they call that number to do that thing that we hear about where you're teaching the man to fish instead of giving him the fish.
Exactly.
And I think this is a missed opportunity we do in a lot of different directions. But my concern, my folks don't know about 211.
Yes.
How are you going to make them know about it?
Yes. And
So you tell me, what are y'all doing about that?
Absolutely. I want to tell you about that. So first of all, the first thing that we had to do, and this is, the first thing we had to do was to make sure that all of my staff knew what 211. As a matter of fact, we closed up at 3 o'clock today a survey from staff to shore up, to ask them the question, what do you do when you need to give resources out? And one of the answers on there is, I don't know what 211 is. And we've been trying to close that gap using multiple things. And so what I will offer to you is that I believe that the last time I peeked in on the survey, we had 0 people taking the survey that said, I don't know what 211 is. So now I present to you, Madam Secretary, 3,200 persons in DCFS that now become advocates. But we also did in that CEA decide that we purchased the ability to resource 211 enough for us to get the word out. And so we're here talking about it today, and we're asking that you all know and become ambassadors as well. So Sarah Berthelot, who works on behalf of the Louisiana Association of United Ways for 211, is happy, I'll speak on her behalf, to come and anywheres to be able to get the word out about telling people to call 211. In addition, the other thing that we did with that is we knew that there were going to be some organizations using the Unite Us platform, and there would be some organizations that 211 knows about that are not using the Unite Us platform. So in that CEA, we have 9 individuals, 1 in each region, whose sole job is to take a referral. If Senator Barrow needs to send a referral to somebody, send someone to a referral that's not on the Unite Us platform, that 211 care coordinator will pick up that referral, handle that referral with the organization that's not using the platform, put the notes in the system, and make sure that it happens. And so we are rolling it out. The governor is interested and has recently spoke to the secretary about it, and so we're excited about where we can go with this. But this is another one of the things that allows us with the culture and climate work that we're doing at the department is really to awaken people to do the work that they really want to do, right? No one comes to the department just for a job. You would be turned away at orientation if you didn't want to really help people. So awakening that and allowing people to really have more tools to help people has been another one of the strategies. In addition to continuing to open up various avenues for people to be heard, and also, so this is about employee engagement, but it's also about constituent engagement, the people that we're helping to be able to get feedback from them. So we're building a plan that we will be able to share with you more as we go forward. I know we had a lot on the calendar for today, and we've got some other things to put in place. And one of the things I think that the secretary expects that as we continue to fill your binder, we'll have more about this information, and I'm be happy to talk more about it.
Why don't we do this? Senator Mizell, you had any more questions? Why don't we do this? Because we're covering a lot of subject matter, and we don't want to cut anything short, but why not, if the committee's agreeable to this, why don't we take the timeline document that we have, and what I'd like to do with the format here is kind of a lightning round of, because we have the 7 categories. So when we take the 7 categories, kind of go through, we can see the timelines. If any committee member has anything on those bullet points, we could start with the first thing, which is recruit and retain staff and foster caregivers. So we could look at it. We see where your timelines are. We see where your levels of communication are. And on each one of those, we can have kind of a lightning round. If there's no questions, we move on to the next one, just a brief comment, and we'll go from there. So I guess I'll get it started. It seems like one of the things we did talk about a lot is the job fairs, the outreach, going into communities, let them know what we're doing. I see you have timelines that are going to go until October of next year. It seems like you've gone to a couple of regions, and what I can remember from the testimony is that Baton Rouge was the main area that you wanted to focus on. So why don't we just briefly, what did we accomplish? What's on the drawing board? And what kind of were the results, or maybe what are the shortcomings? And we'll take each one of those categories. If there's no questions, we move on to the next thing. If there's questions, we open it up. So whoever wants to take it, why don't y'all give us just and if it's okay with everybody, if I see the communications going, we're going on to the next topic. Is that okay with everybody? All right. So why don't we talk about the first thing, the job fair? You gave us the highlights to it. Why don't you tell us the success and maybe the challenges?
Well, as we've touched on already, in both the Baton Rouge and Lafayette, and we have New Orleans tomorrow, a lot of people come in. As Dr. Hodnett said, it's a wide funnel. We had 150 come in Baton Rouge, 180 come in Lafayette. That boiled down to the 79 conditional offers, and that's for employment across the agency, not just in child welfare. 32 of those were for child welfare. Now, we still, for those conditional offers, we still have to do the criminal history check, the background check, the reference checks. So there's still more work to be done behind the job fair before those people are onboarded and going.
And Madam Secretary, not to cut you short, but we'll just have the report. Has it been beneficial to maybe reach out to legislators in those areas to say, hey, we could partner up? You know people in the Baton Rouge area. Can you reach out to maybe some of the organizations? Have y'all done that?
We did send them, yes, sir, to, you might remember getting yours for last week.
Yeah.
And Senator Carter has his for tomorrow.
Yeah.
And we did that
Very
in
good.
Baton Rouge, yes. So, yes, we are sending them out to everybody. Senator Boudreaux actually, had a press conference the day before the Lafayette job fair and talked about it and highlighted it, and we got a lot of good press on it from that.
Was.
So those, as you see, are planned for every region, and we're doing them. The fear or anxiety is it's a lot of work to get these done. It takes a lot of pre-work and it takes a lot of post-work. So if there's a hesitancy in it for us is, can we keep up the pace and make sure we're doing all the back-end work after it before there's another one
The
the
intake
next
after,
week.
so yeah.
So, but we are committed to doing them in every region of the state because our need is in every region of the state. We're talking a lot about Baton Rouge here, because in Baton Rouge being the pilot, because as I've used the expression, they're the one on fire. Every region of the state needs more staff, and so that's why we've got these literally in every region of the state.
Very good. Senator McMath, you had on that topic?
Yeah, just real quick, Madam Secretary. So I'm actually going to be on the DOTD Roadshow on October 26th. I see you're going to be in Slidell. I've already let my legislative assistant know to go and help out when and where she can, and then promote that on social media. Something I think that we should all do. With
Yeah.
the following that we have, and if any of the media out there want to help promote this as well, that would be great. And then it just so happens I'm going to be in Lake Charles on November 2nd for the DOTD Roadshow, so I'll swing by there as
That'd
well.
be great.
On the way out.
I-
But I view the staff shortage as one of, if not the largest issue, to your comments before, and so these job fairs are a great step in trying to solve that problem. So anything that we can do on our end to help promote that, I think that it's up to us
Yes.
to do that as well, as we share in this responsibility.
Thank you.
Thank you.
I think we have some social media.
I did see.
Positive
I
we
do
have
see.
some social media things we can send you just for you to like retweet and stuff like. Perfect.
Yes. Senator Barrow?
Yes, really quickly. Thank you, Mr. Chairman. So I'm looking at the first bullet point here, just bullet point that talks about looking at developing long and short-term statewide staffing recruitment strategies. And I see that you guys will kind of be reviewing this, seem like every other month. Can you kind of tell me exactly what you're looking for? Because as I look at your list, and you're going to the end of the year, are you guys planning on continuing doing this throughout next year of 2023? Is that part of the goal? And then as you're looking at your short and long-term goals statewide, what exactly are you looking to come from that?
So, just like this meeting, we are taking this really as a working document, and many of the things that we're doing are new, and so we're trying to see what comes of them. Or are they effective? Do we need to continue it? Is it something that we need to pivot from and make adjustments to? So some of them that may not carry out throughout the rest of this entire administration will be modified to carry out as we see the effectiveness. Others, we may determine really we were not getting our bang for our buck there, and we need to do something different. So we really do expect this to be a working document and have it updated regularly for you all. And you know, some things may shift in that.
Okay, so as you guys are modifying the timeline that it takes to train them, the qualification, all those things, you'll be evaluating whether or not that's been effective.
Absolutely.
Okay, all right, thank
Very
you.
good. And y'all, just from a time constraint, as we hit each letter, if there's no questions, a lot of this is self-explanatory, so we really don't need the everybody to have the discussion. But I'll just kind of moderate it, and then if either side wants to say something, we go from there. But next thing is public outreach of advertising. It looks like you've got some social media, you're hiring events, you've got these things going on. Any questions on item B? Seeing no questions, we'll move to C. Hiring process improvement and simplifications. It looks like some things have already been accomplished, and it looks like from there internally your process is moving forward. Any comments from y'all in on that?
I do want to say how grateful we are to both civil service and the commission for staffing us up and giving us the extra people to be able to do this, because I know I sound like a broken record, but when the cuts came to the agency, they just weren't child welfare. We lost human resource staff. We lost staff everywhere. So having the ability to be staff plussed up a little bit from the division and civil services really helped.
So, Madam Secretary and your team, why don't we take just a little break from your side? And some of the committee members, I think, may want to just talk to civil service a little bit, so y'all can take just a little break. So any of the civil service team that's here, why don't we take that part of the conversation, and any of the committee members that have either some questions or an update, I think this bullet point is the right opportunity.
Senator Mills, as we move from the table, I also want to just state that Louisiana Workforce Commission has been an incredible partner with us as well. So Office of Technology Services, Louisiana Workforce Commission, Civil Service, the Commissioner's Office, all have been in lockstep with us for all of these hiring events. So
And you know, as you're talking it through, one of the bullet points were media exposure, IT exposure. Maybe it would make sense for the Senate and House team of IT to talk to your folks, and as you go to an area, they can message that out for you. So maybe that would be another opportunity.
Great, thank
I think Senator Barrow maybe had something before you guys.
Yeah, before y'all leave the table, on page 1, the first page of your strategies, under number 1, it's the second bullet. It says increasing pay, and then it has adding temporary pay options to immediately assist in retaining current employees. But then it say these tools will fall off in February.
Yes,
Is that
ma'am.
something that you guys can explain to civil service? Is that a part of what they are actually controlling here, or?
Senator Barrow, we had to go to the Civil Service Commission for those, and so, yeah, Civil Service is in
Okay then.
charge of that, and
Okay.
we went to the commission, and they are waiting for us to come back to say, how's it working, how's it going? That was just as far as they would go at
Okay,
that time.
thank you.
Senator Mills, if I could correct something that I said earlier, Senator Barrow, you will be happy to know. The MCOs are Aetna, Healthy Blue, and it is Louisiana Healthcare Connection, not United. I said United. It was Louisiana Healthcare Connection. That is the third one.
Okay.
And when it comes to that bullet point, I want to drill on that a little bit. So we'll talk more on that one. So civil service, I know y'all been very patient, and y'all can take a little leg break and stretch a little bit while we go to civil service. Oh, yeah, thank you. So once again, thank y'all for joining us, and we're very thankful that y'all are working in a very flexible manner. And so I think that Senator Barrow, when you had fallen sick, one of the key points you wanted was to make sure you could have a discussion with civil service. So one of the bullet points that we see is work with the civil service to develop full team model. And that kind of started the process to bring you guys in. So why don't y'all give us an update of what's transpired since the last meeting and what's been accomplished, and maybe what hurdles you trying to still maybe cross. And then I'll turn it over to Senator Barrow.
Certainly. Byron Decato, Director of State Civil Service, and I have with me Ms. Nicole Tucker, who is our Chief Operating Officer. Nicole has been working very closely with DCFS, and it has been a privilege to work with them, LWC, and the Division of Administration. It's all been a partnership. I won't repeat what we have done already. I think the Secretary has a good job of already explaining the job fairs and so forth that we've been assisting with. I did provide you a document. This is a document that I put together, or actually Nicole put together, that I provided to our commissioners because DCFS has been coming to our commission requesting pay mechanisms and so forth. We thought it was important to kind of show the overview of DCFS and their different programs. But what you'll see on that paper is all of their existing pays. So for the Child Welfare Series and Family Support, if there are special entrance rates that are currently approved for those individual jobs. And then I believe the last page is the page that are the temporary mechanisms. So the department did come to the commission and was looking for ways to incentivize their employees. One of those ways is through temporary premium pay. Premium pay is not a part of an employee's base pay. The goal of premium pay is to get the employee to stay, because if they were to go to another position that is not authorized for premium pay, they lose that premium pay. So you'll see right now some of their workers have up to $5 an hour, and then they tiered that down to $2.50 for a different level of employee in the Baton Rouge and New Orleans area. That is approved through February. I will just mention that that is very similar to what we have done for the Office of Juvenile Justice, and that's a temporary measure as well. So what the commission will be looking for is basically feedback and data from the agency. Is this helping you recruit? Is this helping you retain your employees? And then we reassess it at that time. So the commission has been on board with their request. I believe that the other request that I did not mention, they also have an incentive policy for a strike team that came from other agencies within, other units within their own agency to come to Baton Rouge and work to get the backlog of cases down. They have some lump sum payments there that are approved. The commission approved that. So we are continually working with them. I know my team has weekly meetings, as Secretary Walters said, with them. So if there is anything that they need, we do our best to position it in a manner that we can gain support from our Civil Service Commission to help them with their needs.
Turk, anything you wanted to add to it?
The only other thing, Nicole Tucker, Chief Operating Officer at State Civil Service. Last time we talked a lot about the minimum qualifications. That's probably the other big thing that we have worked on with DCFS, and that was our first thing after the last committee meeting that we worked on to make sure that we got that in place before the first first hiring event on the 23rd, I believe. So we put that into effect on the September 21st with the agency. We worked with them for a couple weeks to really make sure that we and the department were very comfortable with the minimum qualifications. And I believe Deputy Secretary Ricks talked about how that's kind of a pilot, and we are going to assess, and they're working with several organizations and the metrics to see the caliber of the candidates that they're getting with the new revised minimum qualifications, and how those applicants and those employees are working out compared to those that came in under the previous minimum qualifications.
Which I will say is they should be commended upon that. At a time when we do not currently have applicants, to open themselves up to additional applicants and see if they're going to work, that is something that they should be commended for, to basically cast that net a little bit wider and to see if any of those individuals, how they will tier up to the previous qualifications.
So for one quick question, but when you look at it looks like for all child welfare specialists, there's a premium pay for those positions, correct?
That's based on longevity, yes.
Longevity.
Yeah, that one is based on longevity, but there's also the temporary one specifically for Baton Rouge and New Orleans.
Understood.
Statewide, any child welfare specialist up to $4 an hour, and it's based on longevity with the department.
Understood. So on the temporary one, if someone works out with the department, it becomes embedded in their base salary?
No, sir. That would be something that we would have to work with the particular agency, any agency who has premium pay. We would evaluate that to see, is it working? Typically, we just extend that premium pay. There have been times when we do job assessments, for example, where we may look to see that, funding is available and that everybody's on board with raising the salaries. We could make up for that temporary pay when we relook at salaries and so forth. But typically, we just extend those premium pays as a way to retain those particular employees, because it is a carrot. If they leave, they lose that particular pay.
But there could be where you join it, you're doing a good job, and you could potentially lose that bump?
If the commission were not to extend it, yes. But
Okay.
as I said, we will work with the agencies. If it is something that is proving to be beneficial, we will certainly work with the agencies to do our best to come up with a mechanism to where hopefully the employee would be able to retain a portion of that or have some other pay mechanism that would cover that.
Okay, thank you very much. Senator Barrow?
Yeah.
I think what everybody's taking a guess is you have a good employee, they're performing well, and all of a sudden they could get a reduction in pay. It seems like that'd be catastrophic for the department.
Yeah.
Right, and that's
I think that's
something-
what I'm hearing my colleagues
Yeah.
taking that breath, like,
Yeah.
we hear what you're saying, but it just doesn't seem like a plan.
It doesn't sound, when you are listening to it, when an employee has a job to do and an employee is paid for that particular job, and you have a backlog or you have an emergency situation and you want to incentivize your employees, you're going to pay them for a temporary basis at a higher salary. With a job like this that has high turnover, certainly we would do our best to try to keep that. I have not seen many circumstances where premium pay has been taken away from the employee and the employee has lost money.
Okay.
So I will, if that reassures you, hopefully.
That's a little bit
yeah.
more comforting, because I was going to ask you, how does that work? And I know that you don't control it, that the commissioners actually would make that determination, but that would be, to me, catastrophic, really, for an individual to now have gotten somewhat accustomed to. They're doing the work, they're doing a good job, and then come February, it just automatically is cut, or March. Is cut, and I don't know what the process is. So what is the procedure? I mean, it's going to go back before the commissioners, and when will you have a determination, and what would they be looking at? Because OJJ is in this situation, and so is DCFS.
And we reached out to the department shortly after it was approved to ask and make sure that they were tracking some metrics that the commission will most likely want to see, which are those turnover numbers, recruitment numbers. So we, on our weekly calls, we definitely bring that up, make sure that they're tracking that overtime. If you're not getting applicants, obviously your current employees will be working overtime, things like that, that obviously that pay mechanism is helping. But Senator Barrow, just to kind of bring to your attention the way we've kind of done it in the past with some agencies where we have implemented a higher premium pay, like the $5 an hour, in the time before we get to whatever the temporary end date is, we'll be working on, let's say, an additional or a higher SCR, special entrance rate, which the child welfare specialists already have. That is a part of base. So what we may do is we would amend that special entrance rate to something a little bit higher and then maybe reduce the premium. But when you look at in totality, no one's losing any money. You may just have more that's going into your base under a special entrance rate with a corresponding adjustment, which means all current employees would get that corresponding adjustment, plus maybe a $3 premium pay or a $2 premium pay. But when you look at what that corresponding adjustment did, you also got $3 in your base. So it offsets it. So no one essentially would be losing money. And we do a very deep analysis whenever we are doing something like that, where maybe there is a temporary premium pay that we need to end or we need to look at. We'll look at maybe amending that special entrance rate as well as lowering the premium. And then when you look at it together, no one's losing any money. Sometimes people come out.
So does that happen simultaneously?
rates
yeah,
in
that's
the
what-
SDR at
yes.
the same time,
Yes.
lowering the premium. Yeah, we typically do it at the same time,
Or
so
if-
that no one would lose money.
Or if we need time, we would get the commission to
extend
extend the provision for that temporary pay. You know?
Okay.
I mean, I can't sit before you today and say, yes, that the commission will approve this, but I can attest to you that we will make every effort to ensure that, we're going to do our best to make sure that we come up with other mechanisms to have the employees to continue with what they're used to earning if this is making an impact. And right now, just remember, this is just Baton Rouge and this is just New Orleans.
Okay.
Yeah.
Okay, and we appreciate what you guys are doing and the effort and the time that you are putting into this. I just don't want to. I don't want it to be set up really kind of designed to fail, but it seems like you guys are really being somewhat intentional to try to make sure that we're putting all the safeguards around it and trying to make sure that we're getting it to work properly with the proper funding, because that's the other component of
That's
this.
the other component too. Yes, we would want to make sure that the funding is there. We certainly don't want to increase salaries and then there not be funding for it. The funding comes from the legislative branch. The determination of the wages is going to come from my commission and the governor. But we like to work with the legislature because we don't want to approve something and then the legislature say, well, we don't have money for this. So we need to work as a team with that.
So special entrance rates for child welfare workers, trainees. Okay. I'm gonna withhold the rest of my questions for right now.
Thank you very much. Senator Carter? All yours.
Thank you, Mr. Chairman. I have in front of me the hiring fair for tomorrow, October 21st. Today is October 20th. Just for the people who are watching at home, especially those in my area, and I guess I could have asked DCFS, what's the range of pay that's going to be available for like some of these positions? Like there are jobs available. There's a health fair. I keep saying health care, but there's a health fair tomorrow in New Orleans, and there's jobs. The pay range is going to range from what to what about? Approximately. If you can help.
I mean, I can definitely tell you for child welfare, let's see.
Child welfare has the trainee is currently their special entrance rate is $36,524. Now they also have that longevity pay that Nicole mentioned. So a new employee would get what, $1?
$4,000 a year.
$4,000 a year, yeah.
Yeah.
So for the healthcare, so there are positions starting off at.
Specifically for child welfare.
This is child welfare, yeah.
So there's positions starting off right at $40,500.
That's specifically for child welfare, and I keep saying that only because they're also, like DCFS in that flyer says it's a hiring event, it's not just child welfare, so they're also looking at social service analysts, that's on both sides of the house, that's on Office of Family Support, and that's on Office for Child Welfare. They have workforce development specialists, I believe, and all of those salaries are going to range. I don't have that in front of me.
And so that was going to be my next question. So I'm looking at the hiring fair flyer, and I see that child welfare specialist. I also see social services analyst specialist. What's the range of pay for that position? Do you happen, if you know, or is that also $40,500, or is about that range?
Social service analysts, I know they have an SER, but just for the minimum was 27,000 to about 27,700 to 53.
To 53,000?
Yeah, but we're currently this special entrance rate that was
Special
approved.
entrance rate, that's at 34,153.
Yeah.
So somewhere between 34 starting, and it ranges up to 53,000.
Yes.
That's the max for that particular
The max.
job.
And then we also have, and I saw on here, administrative coordinators. Mm-hmm. What's the approximate pay range for the administrative coordinators, considering what's the base, and then the if there's any add-ons for that one as well?
That I don't have in front of me.
It's going to be lower, the administrative
lower.
coordinator. It's going to
Okay.
be lower. But we could get that information for you. And I would also encourage, Senator, those individuals that are attending the job fair, those jobs are announced on our website. So if they go to those job postings, they will see that information.
Well, I'm hoping to put on social media that, that there's a hiring fair in New Orleans tomorrow, where we're going to be looking for how many jobs are open? Do you know approximately how many? Approximately.
So I don't have that information in front of me, but what we're doing is looking for all qualified candidates and the best of them, and even talking to them about positions in other areas, like if they're showing up in New Orleans, but they're really also available to work in Baton Rouge. So we'll be working with them. And we're doing a little bit of what I would call overhiring, understanding, for example, that in Baton Rouge, there were 11 persons that were provided on the child welfare side a job offer, but we only will be onboarding 8 of them. So understanding that there's an attrition that naturally happens, that we will be looking for as many candidates as possible. So we will be able to provide that information if you'd like to know how many vacancies we have, but we will be doing some overhiring.
And let me ask you, for those individuals who may be watching at home, what sort of qualifications are you looking for? So if someone has a particular skill set, a particular background, how do they know whether or not this is an opportunity for them to go seek a job pursuant to this hiring fair, that we have tomorrow and others throughout the state?
Well, Senator Carter, I would say the first qualification is a love for people and a desire to help. Most of the jobs that are outside of the administrative positions, those are professional level jobs. So they basically require a degree, a bachelor's degree. However, there is a 6 year where you can substitute that degree if you've been working in an industry with children or in social services that can actually substitute for that. We are, though, looking for people who can write. Everything that we do requires lots of notes, and being able to speak well with the client and articulate those things. So in addition to the minimum qualifications, we are looking for people who have the heart, who are a bit hardy, because there's a lot of reasons not to take our jobs, but the best reason to take our jobs is because you really get to help people.
And when and I understand you said for the professional jobs that a degree is required. Is it required in any particular field of study, or is it a bachelor's degree, or is it a bachelor's degree in social science, social work, or psychology? You tell me.
Absolutely.
That was part of the minimum qualification update specifically for child welfare. Workforce development specialist, that's a professional level job. It's just a bachelor's degree.
Okay.
And that's the same thing that we did for child welfare. It's just a bachelor's degree. The 6-year sub is just 6 years of working experience essentially. Whenever you get to the specifics is the type of experience. So if you want to qualify for a higher level within the series, so instead of a child welfare specialist trainee, maybe a 1, 2, or 3, that's where the specific experience will come in. But I will say that we will have civil service staff there. I will be there, where we are actually working with applicants that are coming in. I will say, especially in Baton Rouge, I was at the Baton Rouge one. We had several people that came in just kind of, looking for a job potentially and didn't really know where to start or wanted to know more information about the different jobs. We were able to look at their application and say, you qualify maybe for all 6 jobs that are available. You only qualify for these 2. Maybe you don't qualify for none. But I will tell you that rarely happened, because I think even in New Orleans, we are looking, or y'all are looking for the transportation worker, right, which essentially that minimum qualification, I don't think is anything. Is a high school degree.
Yeah. So if you have a college degree in any field, or if you don't even have a degree, you can show up tomorrow at this hiring fair, and the state is going to help find those individual jobs.
You will tell them what jobs they qualify for, yes.
And many of these jobs, the value about having HR there to talk with them, or that they're in career progression groups. So HR can explain to them how they will progress through their series. So yes, we're offering you a starting salary of this, but within a year, you'll be here. In 2 years, you'll be here. So it's a good opportunity to meet the applicants face to face.
And do all the jobs come with benefits?
Yes, if it's yes.
Health benefits, those sorts of benefits.
Yes. If the full-time positions will, yes.
All right. Thank you, Mr. Chair.
Very good line of questioning. You know, the way Senator Carter was handling this, it was almost like what you see at the 12 noon, meet your neighbor or whatever, where it's it really is. Y'all may want to think of asking, but in anticipation of going like to one of the sites, to be on one of those morning shows or noon shows. So many people watch that. And basically, this is the same rapport. You know, what does it pay? What are the qualifications? So y'all might want to reach out to all those TV stations in anticipation of going there, to be on those community shows, because every community has one, and it was really, this was a good dialogue.
Thank you.
Senator McMath?
Real quick, and to add to that, that's a great suggestion, Mr. Chairman. But also, at least in my area, our chamber is pretty active, and we've got a number of organizations like that across the state that would be good, I think, to reach out to and let them, spread the word on these job fairs as well.
Thank
So,
you, Senator.
and
It's
that's-
one of the best things with Louisiana Workforce Commission has been tapping into all of their networks to help the word out to you. And I think it does include them, but we will definitely
Okay, great.
reach out to them directly.
And since this is a working meeting, we have a lot of TV stations here. If you want to give us a free public service announcement, we'll show up. Y'all just talk to your boss.
We'll be happy to show up.
Yeah, we'll go do a public service announcement. Senator Barrow?
Just really quickly, last question. So we have another meeting in November and in January. Will you guys be able to come back to us probably at least by January to let us know what is the status from the commission?
Yeah, certainly.
Okay.
We will make sure we're at every meeting.
Okay.
Great idea. And
Thank
we
you.
appreciate you being here. Any more questions for Civil Service Committee members? Good. Thank you all for being
All right.
here.
Thank
We
you.
really appreciate y'all. Okay, so we'll keep our lightning round going, and we'll try and go through our deliverables pretty quickly. And once again, thank you for your flexibility in being here. We appreciate that. Oh, okay. Yeah, good report. So y'all, the next item that we basically talked about the civil service piece. So why don't we talk about expand and deepen hiring pool? It says your pilot was revised, the evaluating structure. So unless the committee members have any questions there, I'll just kind of hit it real quick, and if it's something a committee member wants to ask questions for, we'll go from there. So y'all will just be available to answer questions, if that's okay. If there's an item that you really want to target, then we'll just go from there. We'll do that. We'll finish page 1. University outreach. It seems like you have some timelines on that, and that's getting ready to be executed in October. Attracts, I don't see, if I see the board lit, then I'll go from
I
there.
would like to highlight what we're doing now. We're hiring college students in their last semester of college as a part-time employee. We've named it the STAR program, and I can't tell you what it stands. Student Talent Acquisition Recruitment, I think.
Very
There you go.
good.
And we have our first one in the office. During this last semester, they will be doing all the training that we normally do with you when you come on and start with us for 6 months. So they'll be learning all the things that they normally go through in that 6-month training. So when they graduate, they will be ready to carry a caseload, not a full caseload. They'll still have to be supervised and all of that. But this, I think, is a phenomenal step in the right direction to shorten the time frame that it takes for us to get people to full case carrying staff. So
Very
that's
good.
that working with the universities.
Very good. Item F, I think we talked about that pay incentives. I think
Covered that.
that item was covered. So now we'll go to page 2. And members, if I'm going too fast, just you stop me. But if I see the board's lit, we'll go from there. G is attract staff, hiring, planning, and caseload forecast modeling. And some of that looks like it's been accomplished in September. And it looks like one of the tasks will be ongoing every month on that issue.
Yes,
The board is clear. Staff health and wellness, evening and weekend coverage. It looks like that's been accomplished, and you have some more going on that.
I would like to just point out that that is one of the things that we talked about as being a critical piece for our staff, is that the same people who are working Monday through Friday, come to work at 7, never know what time they're getting off sometimes, and also have night call and weekend call. And so we are piloting in 2 places. We're starting in Baton Rouge, and then we'll be quickly jumping to New Orleans with it. We interviewed 3 companies that provide supplemental staffing, social workers, that have told us that they can get them to us within about 3 weeks. And they will go through our training, and they will take the night coverage. Now, the first couple of months, it will be in partnership with our staff, but our goal is that ultimately they will be able to cover the work for our staff after hours. So we'll plan to do a 3 to 11 shift, 11 to 7 shift, and then weekends as well.
Very
And that
good.
will relieve our staff from having to take night call. And it'll be for our intake investigations and also foster care staff if they have emergencies that happen that can be handled that way.
Terrific.
There's one of the things you've heard over and over from the people that are reaching out to you is the demands of the work and how they don't have work-life balance. If I had to pick one thing that I think will impact that the most, it is taking away night and weekend work from them so they will know when they get off. Now, those night shift people won't carry the caseload. Think of it like in a hospital. The night nurse is going to hand the case off to the doctor and the day nurse when they come in. So we're working with the judges because that means a change in protocol of who goes to court. Because in the past, you got the case during the night, you went to court. So we're working hand in hand with our judges on all of those protocols.
Very good. One, if it can be done, I'm sure it can be, but as like, let's just pick on that one item on H. It says explore contract options and staff preferences, and it says October is the goal. What I think would help in the discussion, not to have the meetings too lengthy, if that's been accomplished, keep it in green, but put a little highlight on it that it's been finished. If it's not been finished, then it stays in green. I think that would help us to understand, if it's been completed, then you put the star in there so we can hit those goals. Senator Barrow?
Yes, thank you, Mr. Chairman. One of the issues that I heard early on when everything kind of started bubbling up with the department as it relates to staffing issues was how cases were distributed. So I know that I think Ms. Ricks is kind of doing something with the staff and working with the staff and hearing from the staff. So now that we are going to be starting this new model, how are we going to be ensuring that whoever gets the case the next day, how are those cases going to be distributed? Whoever doing the night work, is there going to be somebody who takes all of the cases and then distribute them out to all of the workers? How will that process work and make sure that it's done, I guess, fairly, equitably, and that not one person is doing too many of the cases?
Yeah, so that is all of the work that's going on right now. How do we hand off those cases? Right now, if you are on night call, you're not getting cases during the day. You're not getting.
No, I'm talking about when the new group comes in.
So we're trying to change it from the night call model and make sure that we have a way to hand off to people that is, as you said, is equitable. We're working out all of those details right now.
Okay.
We really don't have them all worked out.
Okay.
We're negotiating with the providers to make sure that we have some overlap, to make sure that we have time to transition the cases over, carry over the information. So as soon as we get all those protocols in place, I'll be happy to share all.
Who are the providers? You said there are 3 companies.
Yeah, the contract. Can I share that? The contracts aren't.
I'm not sure we can
finalized
say
yet.
those yet,
Gotcha.
Senator, because we're in contract negotiation.
Okay, gotcha.
But we'll be glad to provide that as soon
Thank
as we
you.
can. They are Louisiana companies.
Very, very good. So the next key items is remaining on staff and wellness through J. Anything more that y'all would like to comment? I see the board is clear right now on that. If not, we'll go to K, which would be enhanced staff capacity, incentive training, and professional development. Looks like that's been pretty much accomplished, and y'all do have something right in March to look a little bit deeper into a topic. Any issues that y'all like to bring out?
I would like to highlight and recognize at the table Evelyn Jenkins, who I mentioned earlier. the way Evelyn came back to our attention was she led this program that is highlighted here under K, Create Advanced Leadership Certification through Grambling University. Evelyn was the one that created that program. It's a leadership program for our staff of the supervisory level or above. We had a graduation for the program at the office, and Evelyn and Dr. Rice and the head of the Dean of Social Work all came for the graduation, and it was a lightning, aha, there's Evelyn. Maybe she could come and help us. So if I could deviate or Senator Mills, I just want her to be able to say a few words whenever it's
No, please do.
appropriate.
And I know the secretary was really happy to have you back, and that she was beaming to know you were back in the department. So yeah, if you'd like to say something, please do. And as we work on these topics, feel free to jump in, please.
All right, good afternoon. As Secretary Walters said, she did ask me if I would be interested in coming back to help during this time. And in that, I've spent many years in the child welfare program. I wanted to succeed, so I did agree that I would come back and assist with the day-to-day operations. So I see my task as trying to help the workers to refocus and realign with the mission and the goals of the department and of the child welfare program, overseeing them to ensure that the best practices are being implemented. I have visited 3 of the offices. I've been hired about a month now. And so I visited office in Lincoln Parish, which is where I reside, as well as the Lafayette office and the East Baton Rouge Parish offices. And what I found is I found staff who were dedicated and committed and wanting to do the work of serving children and families. However, I also found that they had unrealistic caseloads, and some of them were functioning outside of their duties, such as supervisors carrying cases, and so therefore not able to commit the time. But once I've come on board fully, I do also see that there are dedicated and committed staff working collaboratively at the leadership level to try to address the needs of staff. And so that is an inspiration for me to continue forward in trying to help the staff to start focusing on best practices, being good community partners, and letting others assist with the work. And so the projects that they're rolling out, I will be helping to implement those in the field and helping staff to take advantage and utilize those, such as the 211 United program, helping them to make those referrals and make those connections with families so that families can get the resources, and just trying to help them to really fulfill the mission of the agency.
Very good. Thank you and welcome, and thanks for joining the department. I guess in your training, because it's so critical, you can have your training manual of what you need to do, but you also have to develop a critical thinking of knowing when to move and when not to move and when to make an assessment. Does that training help critical thinking?
It helps with critical thinking as well as just general leadership principles.
Got you.
Yes.
Okay, well, thank you so much. And jump in at any time. Like I said, this is kind of a working meeting with both groups. So we just covered K, item L is support retained foster caregivers. And I see where you raised the average board rate from $15.20 to $19. That's been accomplished. And anything from either side on foster care?
Members, I would acknowledge and celebrate that you raised the foster care board rate. That came straight from a legislator that brought that up in Health and Welfare in the House. Representative Mike Johnson was the one that fought for that raise and got that raise on the board.
We'll all pat ourselves on the back a little bit on that one. M, retained foster caregivers, services, anything on that item?
We know that foster parents have the same struggles. We lost a lot of foster parents during COVID. A lot of them just simply were not able to continue, and so we are doing a push to gain foster parents as we push to gain staff as well, and to support them so that they are able to handle the kids that we get and do everything that they need.
Yeah, item O talks about hiring a statewide recruiter, which was done. Are y'all seeing some fruits to that,
We are.
that hire?
We are, and in fact, there was an event that the First Lady hosted, and the recruiter was there working with others, and it was faith-based leaders who are going out to help us now with recruitment efforts. We have one group that started in Baton Rouge 2 weeks ago, where they're doing weekend certification now, and they were able to get 18 families in, and they are doing their last weekend certification this weekend, so we are very hopeful that we'll be able to get all of those through the process quickly and get more foster parents on board.
Very good. If you turn to the next page, on all sides, item P and Q also talk about foster care, training, recruitment, especially it talks about the pilot program in East Baton Rouge. We do have Senator Mizell on that one.
Thank you. Thank you, Mr. Chairman. I don't want to lose this opportunity because I think we've all, especially since the Landrys came and testified, we've all kind of been a catch-all mechanism. And I'm going to, if we're all having this conversation, the foster parents I talk to fear coming with complaints or questions of decisions or actions that they feel were not in the best interest of the child. So when I see, I think you called it the, I just lost it, a board or a family, is there some opportunity for them to do something anonymously or, and perception is reality at some point. And when you have a child they so care about and they feel that any complaint about some procedural frustration or worker frustration is going to take that child away, you're never going to find out what's really happening. So it's a missed opportunity to correct it on both ends. So what do you tell those people?
So there are two things that we put in place that we are hoping will have a big impact on that issue.
Okay.
Because it is very, I share your frustration about that. One is the Foster Parent Advisory Board. So
Yeah, I saw that.
we sought nominations from the foster parent group at large and our staff for someone who wanted to represent their region, a foster parent who wanted to represent their region. We made sure that as we were developing the board, we have foster parents who have been there some time to some who are brand new, just a wide diversity of foster parents. They in turn determined that they want to focus on three areas. One is around communication, one is around training and support opportunities, and one is around policy. And so each of them, they divided into three groups, and they're going to have outreach. Each will take one topical area. They're going to have outreach to their peers who are foster parents, bring back information, figure out how, for policy, for instance, what makes sense, what policies do they think need to be revisited, what's the opportunity for them to weigh in on policy, how can that happen? So trying to look at each of those topical areas to say how can we make improvement, be more transparent, have their voice heard more, and resolve issues. The person who is co-leading it with me is a foster parent. And so it's very helpful to have that partnership there, someone who's walked those shoes too. So that has a lot of promise. We have regular meetings on it. It is just really getting started, so it's trying to get everything in place. But we have the people identified, and they've met several times already.
So that foster
One
person
piece.
you're working with. Yeah, okay, go ahead.
The other piece, you'll see the support group and then the ambassadors. So
Yeah.
every tri-region has an ambassador. We have a contract for foster parent support with Rick Wheat and Methodist.
So the ambassador is an
Ambassador.
actively engaged foster parent.
They are advocates for foster parents in each of the tri-regions.
But are they foster parents?
I believe they all are. I'm not sure. Are they all foster parents, the ambassadors?
Are they? No,
No,
they're
I'm
not.
not sure if they were. They
Yeah.
work with the organization,
But
and
but
they help with training. They help with support groups.
but
They
who
connect
are
them.
they being paid?
They're being paid.
Who's paying them?
Through Methodist, the contractor that we had hired
Okay.
ambassadors
Okay.
for each of the tri-regions.
Then again, when you're not going to bite the hand that feeds you. Usually, sometimes that happens.
Well, we're trying to create opportunities.
But the
for-
trust,
to
I
resolve
don't know if
issues.
a foster parent is going to confide in a person that is under contract.
Yeah, we
You
took
know what
it
I'm
I'm
saying? I'm just trying to get it
thinking
where
that
there's
that
a
would be-
safe
Yeah.
opportunity for communication.
Well,
Yeah.
I'd love to work with you about some ideas that you have that might have some distance.
Yeah.
That would make them feel.
Because we
Yeah.
did take it away from contracting with us and gave it to Methodist, so they
So
work
that
for
so
Methodist.
okay.
So,
Okay.
yeah, we're paying Methodist,
that
but
would-
they work for Methodist, and so
Maybe that
hopefully that
it's
makes it.
it's forward motion. So
You have ideas. I'm wide open. I have the utmost respect for foster parents. And
oh
I'm
yeah,
trying to
well I do too.
everything
And
we
when,
can
and when
to
you
support
hear
them.
their frustrations,
Absolutely.
and the most upsetting part is that they feel, they're fearful. So anyway, thank you, Mr. Chairman.
And members, this is what, as the topic comes about, that's why I'm kind of going through those topics. If there's a topic you really want to bring out, just bring it out. Same way with the department, if there's something that we need to bring out. Senator McMath, on that same kind of vein of thought.
Yes, thank you, Mr. Chairman. So the Foster Care Advisory Board, how often, you said you've met a couple times already, how often do you guys meet?
It's every other month.
Every other month? And how many members are
They're working in
in between?
meantime. Yes.
So there's
there are
action
9.
items that need to take place,
Yes.
take back. And
Yes.
how, 9 you said?
9, one for every region.
One for every region, okay. And then the timeline on, the goal is to have, what are you going to do with this feedback that you're getting?
Try to incorporate their recommendations. So, for instance, they identified the areas that they felt like needed most attention. So, what do they determine right now? They are surveying their peers. What policies are the biggest pain points for foster parents? And then they are going to meet independently and then come back with recommendations to us, and we have a programmatic person from every area of the department that is also assigned to assist them with getting the information they need if they are trying to figure out why is this like it is there some reason for it. We have someone assigned from each program area to assist them and then bring the recommendations back to the larger board and try to implement.
Okay, I love this, by the way, so thank you for, this is a great way to address, I think, a lot of the concerns that we hear. But the idea, though, is to ultimately have some sort of final list of recommendations, a report, is that?
Well, it's ongoing, so it is a constant opportunity for them to continue to review and revise and provide input.
Okay, well, whether we do this, in a public setting, or if it's just a handful of us that are meeting, I would love to have the opportunity to be, included in at some point, maybe in the beginning of 2023, and just see how the program is going, what their recommendations are, and because this is, as Senator Mizell said, this was kind of one of the things that was sort of been a catalyst for, I guess, where we are today. So thank you
I'm sure
again.
they would welcome having you all on there. We've been meeting by Zoom because it's people from all over the state, and it's
Sure.
just easier for them to do that. And so we'd love to have you
Okay.
participate.
Thank you.
Thank you, Senator. So we're now going into bullet point 2, multidisciplinary response with key partners, and you did over the last 2 meetings cover a lot of that, and your partnerships and looking at different models and working on a pilot. I guess because it's such a small category from A through E, is there any things y'all would want to bring out or the committee members would like to talk about? I know you've achieved some goal, but it looks like a lot of at the November meeting we can really talk more, because it seems like just so everybody know, our next meeting is November 30th, but it seems like a lot of your hard work is between now and November 30th. Senator Mizell.
Real quick.
Take your time.
Thank you, Mr.
Take your
Chairman.
time.
So when I'm seeing CASAs, that is such a pool of potential workers. Have you
We did have a
you
meeting.
courted them?
We have.
Yeah.
Yes.
Okay. And are you getting any?
There are some things that they're trying to balance. So, for instance, we talked to them about being a resource to help with visits or to help with transportation.
Right.
It was met with mixed reviews. Some think that is their role. Others feel like they would really rather stay in their lane of what they're doing. So the dialogue is continuing to try to determine for those who want to, how do we let them be more involved? One area we've specifically asked for their help in is the educational advocacy. So we'd like for them to take maybe even a lead role with our staff alongside in advocating for the educational needs of the foster kids that they represent. And so they're receptive to that. I believe they're trying to work through some things about who technically can be that representative at an IEP and that sort of thing. But they're working on that in particular.
Are they allowed to attend an IEP meeting?
That's part of what they're working on.
That's what you're, okay.
But that is one area that we would really like for them to help us with.
So, in that direction, I don't see the billboards and the active, wide open recruitment toward, and this isn't you all, but do you know, is there a problem with the funding for them, or?
I'm not aware of a problem.
I just don't
we
see.
have done even joint community meetings where we've tried to do recruitment together and trainings together.
Right.
So I know they certainly are still recruiting, but I've not seen.
Okay. I just haven't seen it like I used to.
Yeah.
Thank you, Mr. Chair.
And committee members, while we taken just a real slight detour, Senator Luno told me that there is something that's planned on the 30th of November that might keep some of the committee members out. So why don't you look at your calendars, and if we do see something, maybe we might want to move it to the 1st that Thursday, but we can talk about that some more. Yeah, I think I'm seeing it might just be me over here. Me and Ms. Peck, that might be the only ones. So we might move it. We'll talk about it a little bit. We'll poll everybody. So on that note, I'm sorry, did I cut you short?
No, I'm good.
You done? Okay. So y'all, the next item would be prioritize high-risk infants and toddlers. And I know we've talked about that a little bit, and I do want to bring out, I guess the thing I'd like to maybe talk about is improve oversight of high risk in home cares, is East Baton Rouge pilot. Maybe we could talk a little bit about that, because I know that was very important for Senator Barrow.
Our staff are working with the judges in East Baton Rouge to talk to them about a procedure to have greater oversight over these high-risk cases where we believe children can remain in the home as long as there is a commitment to the case plan. And so what is happening is that there are a lot of times when the danger is not apparent enough for us to ask the judge for removal, but we're trying to work in home. The parent may or may not be fully cooperating, and so we'd like to work with the judge to have court oversight on those cases so that if they are not willing to participate and the children are in danger, we move to foster care. Otherwise, we'd really like to keep them in the home.
Senator Barrow, all yours.
You concerned about that, Senator Barrow?
So let me just kind of go through, and I really don't want to use that scenario, because we want to make sure that never happens again, right? And as I look at that particular case with the baby, right, with the fentanyl, and y'all have to work with the judges because they have to make the determination, right? Yes. And I don't know exactly what happened in that situation, because to me that, we're looking at the department, but to me there's some other folks here that I need to say are almost as equally responsible. Yeah, you guys are having conversation with the judges now?
We are.
Okay.
The leadership in the Baton Rouge office, including our legal team, is meeting with the judges and other attorneys there that represent parents and others to vet this and try to think about how do we not unreasonably expect people to be part of a court system, because generally family services is a voluntary program. But there are times when if the parents are not willing to participate in services that are necessary to keep kids safe, then we expect it to be court ordered. And under that monitoring, that sometimes that's what it takes to get people to commit, realize how serious it is, and participate. Other times it still doesn't, and then we have the judge who has the authority at that point to take an additional step and order the child into our custody.
So are we looking at ways of how this can be fast-tracked as well? The process can be fast-tracked?
To do more
Yes.
court oversight. So it is available now. We're talking to them about their capacity to take on more and to be able to.
And I'm concerned. I
more
guess
into-
my concern is, as we are seeing more cases, you guys are being, there are a lot of things that we never hear about that you are having to deal with every day. And I believe, I would hope, I want to be optimistic and think that it's going to get better, but my concern is that it's not. And so what are we doing when we have to really move very quickly with some of these cases, because 24 hours is going to be too long?
We do have the authority to call at any time that we feel like children are unsafe. We call the judge and immediately can request a court order. And our numbers in Baton Rouge have gone up significantly in the number of kids who are actually having to come into foster care. Last night, we had 9 children that we were trying to place in the Baton Rouge office. So the numbers continue to go up. Of kids coming into foster care. We used to be able to serve more children in their home. We don't have the capacity right now for staff to be in there as much as they would need to be certain that children are still safe there. And so, unfortunately, that ends up generally showing an uptick in foster care. So we are working with Family Services of Greater Baton Rouge to put into place a contract where they would assist us. They have a cadre of therapists and other resources available. So as they're working with the families, those resources will be available to families. The clinical resources, families won't be having to try to find mental health services. It will be there for them.
So, Ms. Evelyn?
Uh-huh.
Okay. So, Ms. Evelyn, as you are coming on board and you know this as being an issue, what's your position? Is there something that you can add or something that comes to mind that you would like to see or that you would like to implement, integrate?
I think the projects that they have right now, especially the one with Family Services of Greater Baton Rouge, and then there's another intensive home-based program, those are the programs that will address those types of cases that she's talking about. But sometimes if the parents is not cooperative, then you may need to get the judge order to, kind of like Brenda said, to entice them to cooperate with the agency and with the providers that are trying to provide the services. And so I think that we are on the right track with the programs that are being put in place. And we just need to see if the judges will be able to assist us with more cases in terms of issuing that order for cooperation from the parents.
Well, certainly, I know that you guys are putting a lot of safeguards in place and you're doing everything that you can. And at the end of the day, I know all of us are working towards the same goal to ensure that that never happens again. But I'm just a little, I guess, apprehensive. I'm not sure what's happening with some of those parents, and we know we probably have a lot of those parents, right, who are not going to be cooperative. And in those instances, how are we kind of making sure that we are fast tracking, moving it quickly, so that the child is not put.
Yeah, in those cases, generally, your intensive home base, you have someone that's there on a very regular basis for long periods of time. And so their assessment should be able to indicate if this is not working, and we need to call the judge and request an instanter order for the children to come into foster care. So it should be an ongoing assessment that's occurring that will help us to realize when it's moving to the situation that the parents still are not cooperating and something further needs to occur.
I guess lastly, I will say, because I know this is part of the department's motto in terms of keeping the child with the parent or with the family. I want us to kind of maybe broaden that a little bit, because maybe family may not be the necessary family that they live with, but it could be extended family, and that we really look at, rather than our first alternative is to try to keep them with the family, maybe we need to take them out temporarily and put them with somebody else with the family if they're willing to take them, because I think sometimes that has led to some bad outcomes. I just personally believe that. I know that at the end of the day, we don't want to break up families, but sometimes I think that we need to make that an option first rather than second, if that makes sense.
It does, and I think that with the safety plan, generally we involve other family members at that time. I've been away a little while, and I have not caught up with everything that's going on now, but I know in the past is that we involved families to help oversee, and the family members can tell us what's going on also, and whether or not problems are continuing, and if it's escalating to the level that we think that we need to remove the children.
Thank you.
Thank you for your question and answers. Senator Mizell?
We're tag teaming. Thank you, Mr. Chairman. Listen to the numbers, and I know how strongly my colleague cares about everybody that we're talking about today. But what I'm wondering is, on the numbers, like with East Baton Rouge, I know it's a mixed bag through the state, but the increases you're talking about, are those mostly drug-related, substance abuse?
Yes.
So it's mostly where the parent is not able to care for the child because of an overriding situation with the drug addiction. So is part of what we're doing, when we set up a reunification plan for that child that's being neglected because of the home situation with the drugs, I'm just wondering if we're doing it in a way that didn't address the drug situation we've got. We're doing it the way we did it with the reunification. That's not possible for someone addicted to recover from in time to get their child back. Am I making sense to you?
So it would always include drug treatment if
Right.
if
But
drugs
in
are-
order to do that, the children have to stay with somebody, foster care. I don't know what the
And it
percentage.
depends, because there is such a wide range of people who use drugs. So there are people who use marijuana and have lots of children in their home that they are able to
Oh, it's all
safely
different.
maintain.
Yeah,
It
yeah.
is. It's just such a range. If we took every child of a parent who uses drugs, the state would be overflowed.
No,
But-
and I'm not that's not my point. My point is, what I get, and I don't know if my colleagues get this, is either the case plan is just checking the box and it's really not making a change in the parenting ability, or it's way too hard, the parent can't possibly accomplish it. It's one of those. It's one of those. And when we have an overriding number of parents that the drug addiction is the reason we're having to address the need of the child, maybe we need to look at a different model. And we could talk about this, but Kentucky just did something that is like with what you're saying today. Kentucky has residential facilities now, and I think there's a pilot in New Orleans right now where the children go with the mother.
We do have
The
that.
mother's not being deprived of her children, and her children are being counseled and helped at the same time that the mother is being brought out of addiction.
We
So,
do have that.
Is that only in New Orleans, though? Where is it? LA Safe, because I know VOA said that they're doing it in New Orleans as well. But we're going to have to, we got to get outside the
For a
box
couple of
because
programs like that. We are part of, LDH was just awarded a grant and they were accepted into this policy academy, and we are part of it. And it is to look at how do
How
we-
long is it going to be? How long can you look at it? How long is the grant going to give you?
I don't know. We
You
just
don't
got
know.
notified
Okay.
that they received it and that we were part of the application. And so it's a policy academy where you come together with other states and look at how do we address this issue? What are the best practices? How do we get out of the box? How do we make sure people have the right resources and that in the meantime, children are safe?
Well, yeah, because the mother's having to leave the children to go to a long-term treatment center. It's not working on either side. So, okay, anyway, we'll talk about that. Thank you, Mr. Chairman.
Very, very good. So, members, we do have, if you turn that page from B through L, many of these topics have been discussed over the last two meetings. I guess I would throw out to the committee members any questions you have on it, or if there's any specific things that the department would like to either highlight on that. I guess the only thing I'd ask is, look like you hired some nurses for a pilot program in East Baton Rouge. Is that going well for you?
Very well.
Very well. Very good. Because I know y'all had mentioned that earlier.
Yes, very well, and we really recognize the necessity of having that resource available to us throughout the department.
So I think Senator Barrow wanted to
Really
question.
quickly, are you guys integrating the nurse partnership program into
Nurse-family
your work?
partnership?
Nurse family
So,
partnership.
nurse-family partnership, the criteria is a first-time parent
Yes.
and within the first trimester. So it generally does not fit in, although sometimes it does, particularly if there is for instance, in our extended foster care program, if one of those young people becomes pregnant for the first time, we do have priority in those programs.
Okay.
They are put in, and we make sure that they're aware of the resource.
And I keep forgetting about that in terms of the first child, because it's such a wonderful program. Because research has shown that once you are able to really make sure that those children make that bond and connecting at birth in the hospital, the chances of them being great parents are really, really high. So,
Child First is a partner with Nurse Family Partnership.
Okay.
And it serves them until the child is 5, I believe, is that model.
So you guys are working with them?
Child First is part of, yes, it's the same parent company, and so many of the strategies that are used in the Nurse Family Partnership Program are also incorporated into Child First.
Okay, great. Thank you.
Thank you, Madam Vice Chair. Anything more, y'all, on items B through I? Anything more on that? Everybody's okay with that? Number 4 of the 7 bullet points: coordinate with managed care organizations. Kind of help us to understand, because this committee has heard a lot about the 5 MCOs and the capitated rates and with their delivery. What you're proposing here to select managed care organizations to serve foster children, and the work he's doing, are any of these services contractually already obligated from those managed care organizations? Because it seems odd that some of the MCOs are saying we can do this, others are not saying that, because it seems like with them being paid per member per month, I guess I would just pick on the foster child portion, because it seems like each child that's in foster care, I would assume, should already be covered under the managed care program, so y'all shouldn't have to be doing more things. So should we be calling in the managed care organizations at the next meeting to say, okay, here's what we're expecting of your contractual obligations? What is DCFS having to do differently on this?
So that is what we are trying to figure out right now, because there's a current contract now that we operate under, and then there is a new contract that is effective in January. And we are working with LDH to look at the components of the contract and to make sure that at the ground level that the practice actually works for us. For instance, being able to have access to 24/7 medical consultation, telehealth. Some providers will offer that, others do not. We have got to have that where that is available to staff and foster parents. If we bring a foster parent a child who has diabetes, let's say, and they've never cared for a child with diabetes, they ought to have access
Correct.
to medical consultation immediately to understand medication and that sort of thing. So there are a lot of pieces to the managed care program that we need to shore up and make sure that are actually available to the children.
You know, not to cut you short, but we pay these managed care organizations to move the needle, especially like on that disease state, and they're getting paid so much per member per month. And when we've looked at some of the medical loss ratios, some of these patients are not even being seen on primary care. So this is something that we may expand on. I saw Senator Luno vigorously hit his button, so I think he's got something to say.
I would really like to have that information for our next meeting,
Okay.
so we can address that.
Okay. Be thrilled to
We pay
partner with you on that.
lots of money for these services, and they need to provide the services that they've contracted to do. So let's try to address that next meeting.
Yeah, I kind of thought we were at an all-you-can-eat buffet. I don't need to pay for some secondary meals. So, you know, I mean, it's true. It's like I went to an all-you-can-eat buffet and they tell me what it's going to cost $10 for the baked potato. I don't think that makes sense.
Well, and you know, I will just say that they operate under Medicaid rules, and so it's medical necessity. And oftentimes, medical necessity does not correlate to functioning well. And so payment may stop for something. They no longer authorize payment for something because it's not technically medically determined to be medically necessary, yet.
Well, we're going to have a conversation.
Yeah, that's right.
And I
Need to work those
And I
things
will
out.
tell you, let's, between your department, LDH, our staff, I think we may need to call in some more folks on what's their contractual obligation to meet. So why don't we put that on our major to-do list, and we'll all work on that one together.
Be great.
So on that note, unless anybody wants to talk more about managed care, I think this one is going to be a to be continued, huh, committee members? Yeah. Okay. All right. Ms. Peck, anything you think we missed on that one? Seriously? Because she has a lot of experience from this arena.
I just think it might be beneficial to all of us in the room right now to understand better what the indications are, because select managed care organizations to serve foster children, and you have a check mark by it that you've selected 3. Have you entered into contracts with them already, or what have you committed to? I think that's important for us to know as we're trying to understand, if we're talking about the Medicaid population, what are they're already supposed to be providing services. So we just want to make sure there's not duplicate contracts floating around right now.
No, so.
Good point.
The contracts are with LDH, and then LDH contracts, I believe I'm speaking right, with the managed care organization. The managed care organization is responsible for the provider community and contracting with providers. We are over here just the recipient of the services, just like a parent whose child is receiving Medicaid.
So
we're a
what
step
is
removed.
your indicator here is that you all completed this task in September. What specifically is the task that DCFS completed with regard to these 3 MCOs that you referenced earlier?
So we had interview with each of them to understand what they were willing to do above and beyond to try to serve children in foster care. So for instance, one of them is willing to have ongoing rounds with us where they will provide a physician to walk through the case and talk about a child who is in a psychiatric residential treatment facility, perhaps, and actually help us move that child to the next level of care. So these very difficult cases, they are coming to the table weekly to have rounds with us and discuss these cases. Everybody doesn't do that. And so it's not necessary, I guess, as part of their contract. So others who have said, we will go above and beyond to do some things. We also would like to have someone help us develop a sort of a sub-provider community who are willing to develop some expertise in child abuse and neglect and really understand what we're needing when we're talking about an evaluation of a child in foster care. We don't need to be bringing children to the hospital for routine evaluations. It costs a lot of money. It's inefficient, and so we need to have local providers who are willing to see our children in either urgent care setting or in their offices. We don't have that provider network right now established.
Ms. Peck, any other thoughts?
I have a lot of thoughts,
Yeah, I
Mr.
do too.
Chairman.
I have a lot of thoughts, and one of my thoughts is, as the vice chair and I were talking, that should be managed care. I mean, that is part of managed care, and that's where. Anyway, we probably all talking to each other on the same page, but let's put this as a major to do, and one of the two departments and staff will talk it through, but we're going to probably need to splinter this into a deep conversation at the next meeting.
Okay. And they may say there are things that are part of the contract and they will be willing to do that just haven't been brought forth yet. So that's what we're trying to explore with them. We're saying, here are things that we're not getting, and they're a pain point for us right now. How can we get that? Is it part of the current contract? If it's not, then do we have to have a subcontract for that? So for instance, the thing I talked about earlier with mobile crisis. LDH has put into place mobile crisis for adults only. It's not for adolescents. Yet mobile crisis is one of the things that's been shown to be extremely effective in being able to maintain a placement. So we would like to have conversations with them about the opportunities to implement mobile crisis for adolescents.
We just don't want you to have to buy something we bought.
Yeah.
That's the bottom line. That's the bottom line. Have y'all entered the contract already?
No, so what we will be doing actually when we say a contract, we have children who are already in our system that need to be assigned to one of the managed care organizations. And so it's that process of assigning children to those managed care organizations and trying to figure that out, and then having an agreement with them about the way the procedures will work. Will they have someone available to us when we don't have, when we're having a problem with a child who needs to get into a facility that is saying that they won't take them? Those kinds of things. So it's not the official contract of what Medicaid covers, it is the practices and the on the ground making it work.
Well, if it's Medicaid coverage, you shouldn't have to be working on the networking. So we'll talk more on that issue.
That would be great.
And I appreciate that. So that one is going to be probably a big item for our next discussion. Item 5, y'all, is enhanced training and coaching of staff. Y'all talked a little bit about that. It seems like you have some pretty good goals for October, November, and December. Anything the department y'all would like to add to that? Because I know y'all talked about training a lot.
Yes.
Members of the committee, any questions you have on that issue? Seeing no questions, then we are making progress. We'll go to item number 6 on the very last page. And I want to thank everybody for your patience, but I think this was important. We drilled down on that. So improve safety decision-making, intense oversight of complex cases. I think that's probably really critical, because we've always talked about critical thinking, and you can train somebody as hard as you can, but they do have to have critical thinking to know when it's the time to make those decisions. It looks like you're going to be doing some of that in October. Anything y'all want to expand on that? I know we've talked about it.
Just that there is a model that has been proven to work in several other states. That is, we call it a central consult. So it's centralizing the availability of a supervisor to walk an investigator through a case and close the case expeditiously when it's determined that all the children are safe and the case is not valid. And so that frees up the time of the supervisor on the ground in the office to really focus on those more complex cases where children are not safe and they really need to do some safety planning.
So in your pilot project that I see on A, subtopic, key centralized consult and decision-making in the different parishes, talk about it. Have you had success?
It's going very well, and we are expanding statewide.
Expanding state. Okay, very good. Committee members, any questions on that topic? Seeing no questions, then number 7, conduct critical incident reviews. Anything we'd like to add to that?
I believe you have information about the critical incident reviews. Casey Family Programs is sponsoring our membership in this consortium. We will start in January. It is a group of states that come together to look at critical incidents, most notably fatalities, to look at what are the common factors. What they found is that it's easy to just blame one person, either the caseworker or the parent factors. Where do you just put that blame? But oftentimes there are systemic factors that they really think if we could look at, we would see a whole different picture, and so our interventions would be different. It's a practice that is used in medicine. It's used in the airline industry. Those are incidents where it's hard for people sometimes to come forward and acknowledge mistakes along the path. And so it's creating this safety net to be able to talk about those potential mistakes or those processes that are in place that have the potential for a bad outcome. And so that is creating that culture where we can look more critically at fatalities and other incidents that happen and really understand how we might be able to make changes to impact that.
Senator McMath, all yours.
Thank you, Mr. Chairman. I'm actually familiar with this in terms of the airline industry. I think when, I don't know if it was United or American or Delta, but when they implemented this within their own company, this sort of self-reporting that would be free of any sort of backlash, it dramatically, well, one, all the other airlines quickly adopted it, and it dramatically reduced the rates of incidences to the point where I think we've only had one, knock on wood, one fatality since the FAA has imposed this across the board. It's a wonderful way to conduct your business, and that's very encouraging to hear that you guys have adopted something similar. That's all. Thank you.
Thank you very much. So members, we went through the tasks, the different tasks and the timelines. Unless you disagree, I think at the next meeting, and we're going to have some concluding thoughts. I'd like everybody's thoughts, but I guess from the action steps, what I'm thinking is we'll really concentrate at the next meeting on what was said in October was going to be looked at, in November was going to be looked at. We'll drill down on those topics more because there's some long-range things that there's no use getting into what you want to do in March of next year, but we'll see what we accomplished in that period of time. And members, if any of you have any other thoughts, let's communicate that to the department to put on the task list, to put on the to-do list, and we can go from there. And we do have a question by Senator Pope.
Now, I think I heard a while ago, and I threw out something a while ago that whether I explored or not is irrelevant, but I think you had mentioned the number of employees that you have, wasn't that 3,200? Is that correct? That's the number? Yes. Thank you.
Thank you very much. Any concluding thoughts from any of the members? So, Senator Barrow?
Thank you, Mr. Chairman. And I appreciate, again, all the work that you guys are putting into this. It certainly is being reflected here today as we look through and hear what you guys are working on, the plans going forth, and et cetera. One thing that I must say, and I think it's real important, and I know that we all recognize this, but the people working in this industry are working in this industry because this is something they feel either called to, they have a strong willingness of wanting to give back and help people because clearly they don't make enough money in this arena. When you look at the rate of pay and the range of pay, it is not a lot of money. And so they are committed to the job because they want to make a difference. They want to help somebody, and they want to make sure that somebody has maybe a better path or a better way than they may have had. Sometimes these experiences comes out of their own pain, oftentimes or sometimes. So as we're looking at all of the different measures, because y'all have a lot of things that you're looking at, which is really awesome, which means that you're really evaluating to see what works. I guess my only concern would be, something that I think Senator Pro Tem stated in terms of, trying to see what sticks. Kind of just being real careful about that because you have a lot of things that you're looking at, and I think a lot of these things are great. A lot of great practices, a lot of best practices that have been used in other states, but we won't know until we try. But if it's not working, knowing to pivot real quickly to what does. And so those are just my final comments. And I just want to applaud the workers who are doing the hard work, because it is not easy. And I don't know if I could do it, honestly, because I don't know if I could every day get up after going and seeing a really bad case and having to get up the next day and having to do that all over again and seeing some of those faces that you have to walk away from and knowing that you're limited in terms of what you're able to do in that immediate time space. That's hard. So I applaud them, and I want to say thank you. Thank you, Mr. Chairman.
Very good. I want to thank the committee members for your hard work. I know you have fielded a lot of calls from the public. I know you've had a lot of pressure on you from the press, from your constituents. So I want to thank each and every one of your committee members, and to stay into a working meeting for 3.5 hours. I can't tell you how much I appreciate you. On that same note, I want to thank Ms. Peck and I want to thank Ms. Cannon, because just questions were rolling in as early as 30 minutes before the meeting, and Ms. Peck was on top of answers and give us information, and we so value you. And Ms. Cannon, thank you all so much. Thank you so much. And I'm not sure, I guess I really want to conclude it with the Vice Chair just said. If any of the folks from DCFS are watching this hearing, we so appreciate you. We so appreciate the work you do. And we want you to know that we're working to make it better. So if we found, 100 things that are wrong that we need to work on or correct, there's 10,000 things you're doing correctly. So don't let this spreadsheet think that you're broken as an employee. Just know that we want it to be better, and we can always be better. So on that note, unless y'all had any concluding thoughts, we'll look at the calendar, because Senator Luno did say that there's a function or an event that most of the members may be at. So maybe I'm looking for maybe December 1st. It'd be a Thursday instead of, but we'll poll you guys. We'll poll everybody and see if you're available. We'll get with the department. We'll talk to you about it. But Ms. Peck, please put on our agenda that we want to deeply dive into the managed care piece. You got it.